this opportunity to thank our colleagues. Dr. Shimpa Sharma is giving her time, Dr. Avinash D'Souza and Sonali today. All of them are going to be judges yesterday, and of course Princy Pelletti, who has been there right through from the beginning with me planning this whole program. Then like yesterday it was Dr. Vishnu and Devi and Maria from KEM, Vishnu Devi from Parag, and who was the third person?
Shailaja Manu.
Shailaja Manu from D.Y. Patel. And the first day again we had a with Princy, of course. We also had the who was there the first day?
Dr. Richa.
Dr. Richa from the principal from Gujarat. So all from our program, they all. I want to thank them for taking so much of a lot of their time, but they did a splendid job with all of you. So all the very best to you. Congratulations, and once again, thank you for inviting me to be there in all the 3 days. Thank you.
Thank you so much, sir. Your words of wisdom always motivates us to do better in life. Again, we have Dr. Mary Matthew with us. Dr. Mary Matthew is Professor of Pathology, Kasturba Medical College, Manipal, Head India Program, UNESCO Chair in Bioethics, Haifa, and Council Member for the Department of Education, UNESCO Chair in Bioethics. She has got degree in medical law and ethics and has 25 years postgraduate and undergraduate teacher. Received the Distinguished Leadership Award in Bioethics from UNESCO, received the Bill and Melinda Gates Grant for her work in neonatal injuries in the brain in New, and she has published 108 publications in national and international journals, and she has moderated 26 webinars on the UNESCO COVID series. Ma'am, I would request you to enlighten us about the today's topic and theme for this year, benefit and harm, and how it is applicable in today's scenario, ma'am.
Thank you, Shubham. And can you hear me?
Yes, ma'am, we can hear you.
All right. So it's really a pleasure to be here on the last day of your colloquium and see how all of you have evolved through these 3 days and how experienced and how you're all mastering the art of technical difficulties that we face during this, COVID times. But on behalf of the Indian program of the UNESCO chair, I'm really proud of my chair, especially because the maximum contribution in the world compared to other countries has come from India, and more so from our students. And this is the Rotaract Caduceus joining our Indian program is another feather to our cap, that India is doing well, and in spite of all what is happening around, we still have the desire to contribute to the cause, what is happening in the world, and to deliberate on the difficulties that are there because of COVID. And this year's theme, especially benefit and harm, how can we help as medical professionals? How do we view this principle of benefit and harm when it comes to this pandemic? And many of you, I'm sure, would have witnessed that during the early times in March and April, where we had a flood of cases and the number of cases were increasing, we did have shortage of beds, we had shortages of resources, PPE. And how did we get through this without, so that the maximum number of our patients and people and the public were benefited, and how did we mitigate or reduce the harm during this period? So this is a learning lesson for us, something which is unprecedented and something we've never seen in our lives. These opportunities are for us to grow. And especially today, I'm very curious, and I'm very to listen to the debate and how you're going to battle it out, like you say, and well, what would be the outcomes of today's session and the last day. And I congratulate all of you who have taken the time. You've been doing it very efficiently, and I thank also Professor Russell because, as all of you know, he is the driving force here in taking the cause of ethics forward, not only in India, but around Asia and around the world. And I congratulate all of you, and I thank all our esteemed judges who are there, and good luck to all the participants. Thank you very much.
Thank you so much, ma'am. We also have Dr. Princey Lewis Palati, ma'am, with us. Ma'am is HOD and professor of Department of Pharmacology, School of Medicine, Kochi. Ma'am also heads the South India Unit UNESCO Chair in Bioethics Haifa National Chair Curriculum India Program. She has worked 5 years at Academy of Medical Sciences, Pariyaram. She has got over 80 indexed peer-reviewed international articles. She's an avid researcher and received a Rajiv Gandhi University Health Sciences Grant Prize, a total of about 7 lakhs. And she is also involved into MSAI curriculum designing. Ma'am, I would request you to please motivate the participant for today so that we can begin with the session.
Yeah. So good afternoon, friends. A good day to you all. And I have here for this wonderful session on debate. Dr. Mrinal and I have just gone through the photo elocution judging, and that was a real tough time that we had, and it was a very unique event, that is photo elocution. And now we are looking at debate. Something that we have all seen, but here it is with a ethical case scenario, and I am really happy to see how these youngsters are going to battle against the right, the wrong in the ethical manner in the context of a legal, because ethics is trumped by the legal system trumps the ethics, and ethics are only flexible guidelines, while legal system is placed and you have to be a law-abiding citizen. So friends, we are here for an accelerating debate, and I won't keep you from it any longer. Thank you.
Thank you so much, ma'am.
Shubham, one moment.
Yes.
I forgot to thank Mrinal. I forgot, but thank you, Mrinal, for you also being part of our. Mrinal, as you know, is the nodal officer for MGM and for our UNESCO program. So thank you very much. I'm sorry, in the 3 days I forgot to mention you. Thank you once again for your contribution.
Thank you so much, sir. We also had a special competition called as Photo Elocution, for which we had received entries, and the judge for the same were Dr. Princey ma'am and Dr. Mrinal ma'am. But before that, let me introduce the judges for today's debate competition. We have eminent judges. So I'll start with Dr. Shimpa Sharma ma'am. Ma'am is Pro Vice Chancellor and IQAC Director, Professor in General Medicine, D.Y. Patil Education Society, deemed to be University Kolhapur. Head of the Kolhapur India Bioethics Unit of the UNESCO Chair in Bioethics Haifa, Member Secretary of the Institutional Ethics Committee of the University. Ma'am is also member of the Stem Cell Research Ethics Committee at Sangli with Industry. Ma'am has underwent her medical education at LTMMC Sign. She has MBA in Hospital and Healthcare Administration. She has clinical and teaching experience of over more than 25 years in India as well as abroad. Currently, she is doing her Farmer Fellowship of Farmer Philadelphia, Boston, from the Regional Center at GSMC Mumbai. She has guided more than 15 MD students and 2 PhD students, and she has keen research with 18 indexed publications. She has a currently ongoing research with ICMR Lab Institute of Genomics and Integrated Biology in New Delhi on coronavirus. Ma'am is an avid researcher, evergreen learner, and fond of music and travel. Her famous and favorite tagline is, "When you stop learning, you start dying." Ma'am, we welcome you all. Ma'am, we welcome you for today's session. The next panelist for today is Dr. Avinash D'Souza. Sir is consulting psychiatrist and psychotherapist, consultant School of Psychiatrist, has consulting rooms in Santa Cruz, Mumbai. Research Associate at Department of Psychiatry, Lokmanya Tilak Municipal Medical College, Mumbai. Sir is founder trustee of D'Souza Foundation, a trust that works in the area of mental health awareness across all sectors. Sir is also Associate Professor and Secretary, International Institute of Organizational Psychological Medicine. Sir is International Faculty for UNESCO Chair in Bioethics, working in over 8 countries for the same. I would like to tell you that Sir is also Chief Editor for Indian Journal of Mental Health, as well as Global Bioethics Inquiry. Sir is Assistant Editor for Indian Journal of Psychiatry and works with 8 mainstream and special schools in Mumbai as a visiting school. Sir has been awarded as Doctorate in Clinical Psychology from the University of Hertfordshire, UK in the year 2011. The next judge for the debate is Dr. Sonali Chowdhury, ma'am. Dr. Sonali is a faculty of School of Epidemiology and Public Health and Professor, Department of Community Medicine, Jawaharlal Nehru Medical College, Datta Megi Institute of Medical Sciences. She is Secretary of Bioethics Unit and DMIMS University under UNESCO Chair, Haifa, and was the organizing secretary for the Ethos 2019, the Medical Bioethics and Research Conference. Currently, she is working as a coordinator of the Master of Public Health Program, Convener Research and Development Cell at her institute. We also have a judge for a photo elocution, Dr. Mrinal Pimparkar. Ma'am is currently working as a professor, Department of Community Medicine, MGA Medical College and Hospital. She's also coordinator for Medical Education Technology Unit at MGM Medical College and is a member of Academic Council and Board of Studies for MGM Institute of Health Sciences. She's also Nodal Officer, come Secretary of MGM Bioethics Unit of UNESCO Chair in Bioethics. I welcome you all for today's session and thank you so much for sparing Sunday with us and making a Sunday more memorable. Now we'll move on for debate competition. I would like Anusha and Keegan to take over. Thank you so much.
Thank you, Shubham, for that elaborate introduction.
Great.
Yes. So I now
go ahead, Anusha.
Go ahead, Keegan.
Okay.
So I will present the screen.
Great. Just before we start with the debate. Yes, Anusha. Thank you for interrupting me again. But yeah, just before we start the debate, we will go through the rules so that everyone is on the same page and we don't have any discrepancy with where we are with the rules. Make sure that you follow the rules. You follow you a timer on the screen so that later on the question doesn't realize whether we're actually going with time. We will be displaying the timer on the screen and share your screen till.
Yes, can you see my screen?
Yes, Anusha, we can see.
Yeah, Keegan, would you like to go ahead? Keegan, can you hear me?
No, I see gray. You probably wait for a bit.
See my screen?
Yes, Anusha, I can see.
I can see the screen.
Yeah, Anusha, I don't see your screen. Okay, great. Like we already mentioned, judges, we have 3 to 5 members participating from each team. Okay, so this number varies from team to team, but there are points. Team, please note, there are points for giving each member equal representation. Okay, so do not forget to give each and every member of your team equal or at least close to equal time to speak. We have 3 rounds, as mentioned before. The first round will be a presentation by your own team on the 4 pillars of bioethics. These pillars have been allocated to you well in advance, so we're sure that you've done incredible preparation on how you will present them. The presentation can either be in the form of a PowerPoint presentation, it can be a role play, or it can be an interactive discussion where few members from your team are talking to other members of your team. As long as the idea of what the pillar is and what it stands for gets across to the audience, that's what's expected of you, and that is what the judges will be expecting as well. This is obviously bearing in mind the purpose of the session is to educate and sensitize the audience. and points will be given by the judges for this round. With that, we will move on to stage 2. Anusha, do you want to be on?
Yes. So another thing that I'd just like to add and remind all of you is don't use any of your organization names, since we've all selected names. We'll be moving forward with that itself. So we don't have any discrepancies during the competition. Coming to the second round. So as all of you know, in a conventional debate, the two teams battle it out, and then you have the next two teams, and the winners of both those respective debates go to the final round. So that is just a basic understanding of stage 2. Now, what we have in stage 2, if we go into the depths of it, like we mentioned earlier with you yesterday, there are certain terminologies that you will be allowed to use during this round, which is basically the objection. So there are 3 types of objections, like all of you know. That is objection for leading, hearsay, and relevancy. So you are free to use these to interrupt the other team, much like a jam session that we conduct often. Also, with this, once the judges select the 2 teams that go up against each other, is going to judge session, and they will be the deciding vote as to whether the objection should be sustained or overruled. In simple words, if team A says something and team B objects to team A with respect to either hearsay or relevance, the judge, that is the third team, will decide whether the objection has to be sustained or overruled. If the objection is sustained, then the opposite team will get the remaining time that is allocated to the first team that spoke. However, if it is overruled, the same team can continue and will get an additional 1 minute to put forth their point. So now coming to the time limits and everything else that really structures the debate. Once we start with the debate, like I mentioned earlier, the judges will be allocating which teams go with whom, and the judges are unaware of which organization is represented by the names that you mentioned. So it'll be completely unbiased. Coming to the reading of the cases. So once we decide the 2 teams, a case will be read out. And based on a coin toss, we're going to decide who is going to be the plaintiff and who will be the defendant in this case. And both the teams will get about 5 to 7 minutes to go over the case. We will be reading out the case to you. You can take pictures of the screen. You can discuss it either on your WhatsApp groups or on any other platform that you like. And after that, we will be starting with the plaintiff. So one member from the starting team will speak for 3 minutes, followed by another member from the second team, that is the defendant side, will speak for 3 minutes. Then we will come back to the first team, where the first team counters for 1 minute. And here the main purpose is to speak, so it's not very repetitive. So we request you to keep assigning separate speakers, because that's the point in the judges' guidelines. Coming back to the next team speaking for another 1 minute, and then we have a back and forth session for 6 to 8 minutes that will be conducted by a moderator. So throughout this process, we'll be using a timer, and the timer will be displayed on your screen, so you don't have anything to worry about with respect to the time. After these sessions, we'd also like to remind you that you do get to appeal for extra time, but the appeal is only valid for one debate. For example, if Keegan and I are debating right now, and I also win the final round, if I use an appeal in this round, I can't use the appeal in my final battle. So the appeal is an appeal for 1 minute extra to put forth your point. So you can choose whether you'd like to use the appeal either during the semi-final, or you'd like to reserve it for the final, or if you'd like to not use it at all, that's completely up to you. So in short, this is how the debate will proceed. If you have any queries at this point, you can feel free to ask either me or Keegan. So we'll give you a minute if you'd like to just think about it and get back to us with any queries.
Before we go with queries, let me just read out the criteria that you all will be judged under. The judges have already been informed of this criteria. This is for the participants. You all will be judged out of 10 marks each under the following headings. Number 1, content. Number 2, logical reasoning. Number 3, like I said, equal participation from all teammates. Number 4, respects other opponent's time. Number 5, use of legal terminology for objection. And number 6 is ethical reasoning. Okay, with that, we have also 3 prizes. We have a prize for the best presentation, we have the prize for the best speaker, and we have a prize for the runner-up speaker. This is apart from the winning team. It's different from the prize for the winning team. So all the best, all of the participants, and we hope to see you win something today.
All right. So do you have any questions, any of the teams at this point? If not, we will move on to the judges. So we'd like to a request to all of you, please don't send annotation requests. So now moving on to the judges. The 4 teams we have today are Ninja, Justice League, No Hera Fery, and Antivaxers. So to start with the first round of presentation, we request our judges to randomly select the order of the 4 teams. So if Dr. Shimpa, ma'am, if you'd like to select the first team.
I'm unable to unmute. All right. Am I audible?
Yes, ma'am, we can hear you.
You give us a list starting from Ninja 1, 2, 3, 4. You could take team number 1 and 3 in the first round. Would that be all right?
And 4 on the second round. Right now for the presentation,
Yeah,
which team
that should be good.
to see first? Shimpa, ma'am? Okay,
Yes,
how
ma'am
about
is
we
muted.
ask, how about we ask Dr. Avinash, sir, if
Yeah,
order
Dr.
for the
Sonali, ma'am.
presentation?
I think we can go with the Justice League first.
Sure. So
Can we go with the Justice League?
Justice League, are you ready? I'll just stop sharing screen.
Hi, I had a quick question. I'm sorry I didn't ask it earlier.
No worries.
Regarding the overruling done by the by one of the team members who is not participating, like I had asked yesterday as well. Like, okay, so if I do not agree with the decision given by the judge on my overruling, like for example, if objection. So for example, if I ask for objection, the judge overrules my objection. Can I appeal that objection to the judge, to the main judges or to the organizers, something like that? Because that will actually depend on the subjective understanding of the terms hearsay, leading, and which you have not like explained to us. So can't there be a misinterpretation on part of the student judge?
Okay, firstly, I think we did explain these terms to you last night on our orientation call. That aside, we will not want to complicate things too much and waste a lot of time in all of this. So the jury's decision is final whether the objection is overruled or whether the objection is sustained. Is that fine?
Okay. Could you just kindly explain the 3 terms again? I think I left the stream or something. I might have missed that. Really sorry for that.
Okay. Anusha, do you want to?
Want to understand hearsay, leading, and relevancy.
Okay. So if a statement is made, yeah, go ahead, Anusha. Sorry. Okay, if a statement is made that is trying to suggest something, it's suggestive or leading the whole court into believing a certain statement, that is when the objection can be raised for something, for it being a leading statement. Okay, it's leading basically. Second is hearsay. Hearsay, here you won't. I think it's a question that you yourself asked yesterday, Akash.
Yeah.
Hearsay here does not play a very, very applicable role because there are no witnesses. However, if you do deem it fit to be used anywhere, it is up to you. We are giving you the option of using it. Where you use it, how you use it is up to you again. And the last one is relevancy, which is pretty self-explanatory. If the delegate or the person who is talking, the plaintiff or the defendant that is talking, says something that is out of context to the case that is being discussed, we will raise an objection of relevancy, and the court will pass its ruling on that after that.
Okay.
Coming back
And
to hearsay,
regarding yeah.
No, hearsay is if you assume something that you may not have proof of, and it just particular situation, and you go ahead with it. So basically, a concrete proof on a particular matter that is mentioned in the case given to you, but you're doing it based on an understanding that you developed during the process. Yeah, go. Sorry.
Yeah, I had this. I completely understood hearsay. Could the co-host again explain what leading meant?
Sure. So if I am not sure of something, okay, if the case paints a narrative of, say, story A, and I, as a plaintiff or a defendant, am painting a narrative that is different from the main case, or painting a narrative of story B in regards to the main case, I will be trying to lead the court into that direction. Okay, that is not allowed in a court of law, because you want the truth to come out. You don't want what your version of the truth is to come out. So if you are doing that, if you are found doing that, the other participants can raise an objection of it being leading, where you're trying to lead the court direction that is different from the truth. Is that clearer?
Yeah, that's very very much clear. Thank you.
Thank you.
Another thing that I'd just like to add is, like we mentioned, yes, speeches and the 1 minute individual speeches. So you cannot object during. So the whole objection process is only valid when a single person is speaking from either of the teams, and it can be objected by the other team. So there's no fixed person as such. All right. Okay. That we will start with the presentations. Mentioned by would the first team be ready to present their screen or ahead with the presentation?
Yeah, can you let me know if my screen is visible?
Hello?
Your screen isn't visible as of now.
Yeah.
It is. It's showing something now.
Hello?
Yes, we can see your screen, Team Justice League.
Okay. Can you tell me when to start?
Yeah, I'm setting the timer for 8 minutes. You can start now.
Good morning, respected judges and fellow participants. We, Team Justice League, will be describing the first pillar of bioethics, which is autonomy. So what is autonomy? In medical practice, autonomy is expressed as the right of competent adults to make informed decisions about their own medical care. This principle highlights a requirement to seek the consent or informed agreement of the patient before any investigation or treatment takes place. Let's look at the conditions for autonomy. The individual has to have the relevant internal capacities for self-government. The individual must be free from external constraints, and sufficient information must be provided for the patient to make the decision. This decision has to be a voluntary decision. To demonstrate the value of autonomy, we have prepared a role play for you. Enter Mr. Sajal.
Oh, doctor. I am having a terrible headache. I am feeling terrible. Please save me, doctor.
What happened? I'm here for you. Just tell me, what are the symptoms you're facing right now?
Doctor, I can't tell you what I am feeling right now. I am having severe pain in my abdomen, doctor. My whole world has gone upside down. I can't breathe properly. I can't swallow properly. I I just can't just not to forget the persistent chest and back pains, doctor. Please save me. Oh my god,
O-
have I been affected from the coronavirus?
Okay, calm down. We'll have to run some tests. I'll just take you for a CT scan first of all.
Mr. Sajal is wheeled into radiology and the CT scan report arrives.
Oh my god, I think it's abdominal aortic aneurysm. I'll have to talk to Dr. Tanya about it. Good morning, Dr. Tanya. I just had a patient and this is his report. Could you please have a look at it? I feel it's abdominal aortic aneurysm and please let me know what should we do about it.
Hello, Akanksha. Good morning. Let me see the CT scan. Process is correct. This indeed looks like aortic aneurysm. To make sure that the patient undergoes surgery in the next few minutes. To the patient about it. Hello. Am I audible?
You are.
Uh, I'm going to be very honest with you. You have been diagnosed with aortic aneurysm, which is a blood vessel of your body has a bulge and it might burst anytime. We have to make sure that you undergo an surgery, and even after the surgery, there is only 50% chance that you might survive. Without the surgery, however, you might die. So, Mr. Sajal, you have to make a choice.
What? Surgery? No, 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 not at all. I'm a model. I can't. My appearance is the basis of my career, doctor. What are you thinking? I will lose. It would destroy my career, doctor. I won't. I can't afford a scar. I won't go ahead with the surgery.
Suddenly, Mr. Sajal faints.
Your No, your life is our primary concern right now. Without the surgery, you will die in a few minutes. Your career at this point is.
Suddenly, Mr. Sajal faints.
Oh goodness, what happened? The patient was really hysterical and scared about the operation. Akanksha, I hope you have assembled the operation theater. We have to wheel him in right now.
Yeah, doctor, I have, but I think we should not proceed with it because the autonomy is the very pillar of bioethics. And how can we just go against the patient's consent and just proceed with the surgery? There has to be some other way.
I'm
The surgeon decides to proceed with the operation. Mr. Sajal wakes up after the operation and is shocked to find a scar on his abdomen.
Oh my god, this scar! I will not find any work now. Karan Johar is not giving me advertisements to perform. Also, this hospital, I must tell you, I have to file a lawsuit against them. I will sue them for what they have done to my body. Even without my consent, they did the surgery. I will file a lawsuit just now.
So Sajal decides to meet with the lawyer, Mr. Arpit, and file a lawsuit against the hospital.
Hello, Mr. Arpit. I heard you are a famous lawyer of this city. I wanted your legal advice for the same. Recently, I had undergone a surgery. in one of the biggest hospital of the city. But what I approached was that without my consent, they performed the surgery on me. I clearly didn't want it. They destroyed my career, Mr. Arpit. I want serious legal action against them. Please help me, Arpit.
Hello, Mr. Sajal. I completely understand your concern. What the hospital did is wrong. The doctor has ignored your consent and breached your legal right to autonomy and self-determination, which is enshrined in the Article 21 of the Constitution. Don't worry, Mr. Sajal. We will definitely file a lawsuit against the hospital and the doctor on violating Section 87 of the IPC. The law will take its course.
Thank you, Mr. Arpit.
Through this role play, we are able to see the importance of autonomy in medicine and how medical professionals face a dilemma on a regular basis. Let's look at the role of autonomy in medicine. We have patient-centered medical ethics. This focuses on autonomy over professional obligations. The patient has a role in shared decision-making. We can see in this scenario that the patient did not have a part in his decision-making and his wishes were not fulfilled. The patient has a right to accept or refuse medical care. This changes the balance of power in the physician and patient relationship and engages the patient more. We have to respect autonomy. This is the respect of privacy and confidentiality of the patient. Sufficient information to make informed choices should be given to the patient. And we have to protect persons with diminished or impaired autonomy, such as children and mental ailments. We have to recognize the capacity of mentally and legally competent patients to think and make decisions independently, to act on the basis of their decisions, to communicate their wishes to health workers, and to uphold patients' confidentiality. Thank you.
Thank you.
Thank you.
Thank you to Team Justice League. And with that, we'll move to the next team. We'll request our judges to select the next team that they. The names of the teams are Antivaxers, Ninja, and No Hera Fery. Okay, so based on judges' decisions, we'll be going with Ninja next. So Team Ninja, are you all ready to present?
Yeah, can we start? Can you confirm if I'm audible?
You are audible.
Okay.
Okay. Are you ready, Team Ninja?
Yeah, we are. Yeah. Yeah.
Your time starts now.
We Ninja are here to express why we believe that social justice forms the most important pillar of bioethics. We'd like to explain our stance through a case. A 65-year-old male patient with Alzheimer's disease, severe dementia, and chronic pain presents to the emergency department in acute respiratory distress. With no knowledge of biomedical history, he's intubated and put on mechanical ventilation in view of respiratory decline. His doctors are now made aware that as a part of his living will, the patient has signed a legally binding DNR and DNI form when he was lucid during the early stages of his Alzheimer's. The patient's healthcare proxy, his son, on the other hand, refuses to abide by the living will and insists that the doctors too continue with respiratory support. What would be the best course of action from here on to ensure that right is done by the patient? Should we keep him intubated and deny him autonomy? Should we withdraw life support and go against beneficence and non-maleficence?
So, as a representative for autonomy, I believe that a patient's wishes must be respected. That's why the ethical pillar of autonomy exists. Also, in this case, since the patient's wishes have been explicitly stated, I believe they should be respected. And also, I believe that in this case, autonomy will be coherent with the pillar of justice because it will set precedent for respecting future and future cases, future patients' autonomy in such cases with respect to euthanasia or intubation and withdrawal of life life supporting care.
Okay, so as the representative of justice, right to choose the treatment, but in this condition, the patient is unable to exercise his right, and hence justice comes into action as the element of consent is a critical issue in medical treatment. Justice looks at it in a bigger perspective.
As the representative of beneficence, I would want to say that beneficence is defined as an act of charity, mercy, and kindness with a strong connotation of doing good to others, including moral obligations. As an important pillar in ethics, I strongly believe that putting an end to the chronic suffering with the support and guidance of the pillar of justice, it brings the pillar of beneficence to strength and serve its meaning best.
But an argument to put forward in the favor of non-maleficence. My pillar here stands for no harm to be done to the patient. Being in favor of no harm, don't you think justice contradicts this particular pillar of bioethics? How can you go forward with an act that goes against life and promotes mortality? We have let the mentally challenged lives because it is ethically to let them and do no harm to them.
So non-maleficence means no harm to the patient. Medicine is an art of healing, relieving of suffering and prolonging of life. But in the case patient can't be healed, prolonging of life is of no meaning because it is very unhappy and painful life. And there is only way out, and that is justice. The principle of justice states that there should be an element of fairness in all medical decisions. Fairness in decisions that burden and benefit, as well as equal distribution of scarce treatment, and for medical practitioners to uphold applicable laws and legislations when making choices. When it comes to euthanasia, the Indian Supreme Court has given a historic decision by legalizing euthanasia, but only taking into consideration all the perspectives. Justice looks in a bigger picture. It is not like just social justice is the most important pillar, but certainly it is the only pillar which can bind together all the other pillars and upholds bioethics by adding element of fairness in every decision.
All other pillars stand for one definite virtue, but social justice is what ensures that these virtues are being guaranteed to all other often denied these rights. In other words, justice is the tool that makes these abstract ethical concepts relevant to the people at large. The other pillars aim to be upheld despite their implications, but unlike those, social justice works on a situational basis and often has to allow compromise on one right in order to honor the other in situations where the patient's interests conflict with the patient's welfare.
The principle of justice can be described as the moral obligation to act on the basis of fair adjunction between competing claims, and social justice in healthcare ethics exists to ensure that individuals, irrespective of gender, sex, economic status, nationality, educational status, etc., receive equal access to healthcare and its accompanied rights.
This can be subdivided into three categories: distributive justice, fair distribution of scarce resources, rights-based justice, respect for people's rights, and legal justice, respect for morally acceptable laws. Situations will always arise where decisions have to be taken and there are limited resources, different options, and or other conflicting moral concerns. Vulnerable groups such as prisoners, individuals belonging to the lower economic strata, or those with dementia are particularly at risk in what they are and likely at some stage unable to exercise their preferences with aims to ensure that rights of these groups are protected and equally access to the healthcare is ensured.
So social justice also talks about prioritizing the community's needs as a whole, and is also based upon a principle of rights-based justice, that is respect for people's rights, where the moral, ethical, and legal implications are considered, and how they affect the community as a whole is considered, given due consideration. And after this thorough review, social justice is factored into each case, and that makes it an important pillar and an important part of practicing clinical medicine as a whole.
Justice, we believe, forms the most important pillar of bioethics as it advocates that individuals belonging to all groups have equal and fair access to healthcare. And because it is tasked with upholding and prioritizing the execution of the other principles in order to ensure that right is done by the patient. We'd like to open the dais to questions now for our remaining time. Questions, anyone?
Is it open to participant questions, or can I just ask something?
Anyone.
Team Ninja, I'm just curious. Are you all familiar with the phrase called categorical imperative? Okay. You have 4 pillars of justice. Which one would you think is the most important, which cannot be violated? Can you give us some light on that?
Yes, ma'am. So according to our team's perspective, we understand that each pillar has its own importance and no pillar can supersede the other. But instead, all the 4 pillars have to work cohesively and come to a final conclusion, which is always in support of the welfare of the patient or the person whom we are doing justice to. Hence, we say that no pillar supersedes the other, but instead everyone works cohesively and comes to a final conclusion.
Ma'am, you are right that there are other pillars, but we see that all other pillars at some point or in some examples there arises a need where they are violated in emergency situations where autonomy is not respected and beneficence and non-maleficence cannot be considered in cases of euthanasia as they're in direct opposition. But social justice cannot be violated in any of the known examples till now. So we see that it is more situational and has ambiguity in ethics as a concept itself. So.
Yes, ma'am. So justice is basically it adds. So fairness can never be wrong. Everything can be fair. So if something is fair, any person. So justice adds that element of fairness, which other people.
Ma'am, importantly, like even with our case, we were trying to show that, in the long run, when cases and situations do arise, we do have certain amount of coherence between these pillars. And we, as a team, we believe that, justice is important to uphold that coherence.
Thank you, Team Ninja.
Thank you, ma'am.
Thank you, ma'am.
Thank you, Team Ninja. Thank you for a question of the session also. It made it very, very interactive, and we really appreciate that you obtained questions, especially from the judges. With that, judges, what do you want the next team to be? We have Team No Hera Fery and Team Antivaxers left.
I think we can go with the team anti-vaxxers now.
Great. Team Antivaxers, your time. Are you ready?
Yeah. Can you see my screen is visible?
Yes, please.
Just a second.
Let me know when we need to start your time.
Yeah, just a second.
So, may I start? you could mute yourself.
We can't really hear you. Sorry.
Can you hear me now?
Yes, it is slightly better.
Yeah.
Do I start? Your team ready?
Yeah. So I think
Your time starts now.
morning everybody. Just like our life greeting, we hope to be fresh with our presentation today. We are team Antivaxers and defining the principle starting out with our team member.
I hope I'm audible. I'm going to start now. So every day we're faced with innumerable decisions, our own private experiences and those of our loved ones, set against a background harm formed by those hundreds of lives with which our paths entwine. And these simple actions dictate our every move. Yet for those of us in the medical profession, there's just a thin line between a tiny inconsequential choice and a life-altering decision, because it could make all the difference in the world. Very good morning to everyone. Over the next few minutes, my teammates and I are going to talk to you about beneficence, one of the fundamental tenets of medicine, and we're going to tell you what it encompasses and take you through a few scenarios. So what exactly is beneficence? In common parlance, it merely denotes acts of charity or mercy or kindness with a strong connotation of doing good to others. In fact, it's argued that if the end of clinical medicine is healing, which is a goal of beneficence, then medicine is fundamentally a beneficent undertaking. It goes on to say that whatever we say or do must be for the patient's good, like being honest with the patient always, not subjecting him to unnecessary investigations and futile therapies, and promote the course of action that they believe is the best interest of the patient. Practicing beneficence means that healthcare personnel make an active decision to act with compassion. It can be as simple as holding a patient's hand during a painful procedure to as large as entire organizations undertaking community service projects that have nothing to do with profit, but everything to do with compassion for the community. So now my colleague Surya is going to take the discussion forward.
Ladies and gentlemen, meet Mariam, a 23-year-old mother of young Abdullah, patient of a disease that she struggles to even pronounce, living in Burkina Faso. Pfizer has decided to conduct trials for a novel drug in this region. Mariam now has a choice to make, a choice between providing her child with this novel treatment that is essentially uncharted territory or to continue seeing his condition worsen. This, ladies and gentlemen, is a practical and external projection of what is usually a more abstract and internal ethical conflict. The resolution of this catch-22 is ultimately reached by making a sacrifice. Now, the sacrifice could be too much too soon or a day late and a dollar short. Abundance of various indicators that quantify multiple outcomes may tempt us into making different analysis of different kinds, which are especially futile when a case is singled out. The burden of such decisions is not just on the patient or the doctor or even the healthcare system. It is a litmus test for the social contract that we all sign when we are born into the society. And the pain can be broken down and characterized based on its source, origin, character, radiation, etc. What would you do if you were in William's shoes? Such choices come with the burden of unknown and are definitely complicated by various other factors. Now let's look from the perspective of the doctor is to take up in for the trials. Under the Hippocratic oath, the physician is bound by the dictum primum non nocere, do no harm. Now, the doctor can weigh the relative costs of doing some harm to Abdullah to gain insights into the drug with the hope that in the best case, we have a drug for a previously untreatable condition and young Abdullah is free to walk. But there is always the impending risk of the worst case, which might range from losing Abdullah to entirely losing the knowledge of what the drug is about. This raises the question, to should the benefactor suffer harm for the beneficiary? On an individual level, this is a Rorschach test for all of us who are either willingly or unwillingly reaping the benefits of many such sacrifices while simultaneously paying the costs for different acts. When does this house of cards of beneficence collapse under the weight of its own deeds? That is a question up for humanity to answer. Thank you.
Okay. Now, what if we shift our focus on those parents who are completely against the medication, doing no harm to their kids? Now, that's surely not a wrong thought, right? The fear of side effect of a medication can put a parent to refuse it. In this situation, parents have the full autonomy to take that call. But again, the doctor's duty and beneficence should make them reassure the patients to the best of their capability. This surely can be done with the fact that there can always be a lingering risk somewhere, and to take care that in the course of doing good, they don't cross the line with maleficence. The process should involve a well informed consent from the parents once they affirm on going ahead with the medication. The benefits of the medication should outweigh its harm to be accepted, and in case of a harm on the part of the medication, there should be proper antidote and regulations available to make the meaning of beneficence more substantiated.
So we've met with a lot of literal definitions. I hope I'm audible. We've met with a lot of literal definitions all along the way of the 4 pillars of ethics and how it all works and how it's all intertwined. We've also dealt with an interesting question about the Immanuel Kant's philosophy of the moral philosophy of categorical imperative and the different school of thoughts. But let's not delve so deep into the picture. This is about how we are trying to explain it to a general audience about what beneficence means. The pillar as allocated to anti-vaxxers is what we're going to focus clearly on. We've met with a literal definition, we've met with a paradigm shift, an example of what beneficence means. Now we'd like to focus on the bigger picture here. We've all gathered to understand the 4 pillars, but we're focusing on beneficence right now. There are actually 3 more sides to the argument, and I'd like you to take a look at that. Let's take a hypothetical case-based study. A patient involving having an ovarian cyst that, if left untreated, will result in a kidney failure. An operation to remove the cyst is the best treatment, but the patient is frightened of needles and is completely against the surgery. Now, the doctor must work with the patient to respect that she dislikes needles and doesn't want the operation. Her autonomy. He needs to find a solution that would prevent her from going in kidney failure, which is her best interest. Beneficence. Although the surgery is the best choice, forcing the patient to accept the needle would be harmful. Non-maleficence. And finally, the doctor needs to understand that there would be many other people who would probably need dialysis because of kidney failure and would be in a much dire situation than her. Justice. We essentially argued amongst ourselves when we were having a call yesterday as to should we just focus on our ethic pillar or should we just combine everything all together? But when we came to the conclusion of why we should take it as a summary, we realized that ethics does not work as a lone thing. It works all together. The 4 pillars work all together. And that's why we'd like to end with this quote of Potter Stewart saying, ethics is knowing the difference between what you have a right to do and what is right to do. Thank you so much. With that, Team Anti-Vaxxers, we sign off.
Thank you for that lovely presentation, Team Anti-Vaxxers. So as all of you know, we just have one team remaining for the presentation round, that is Team No Hera Fery. So whenever you guys are ready to present.
Yeah, I will just present and let us know when to start.
Sure.
Is this visible? Can you confirm if the presentation is visible?
It's still loading. So
It's still under
give us some time.
Loading.
Okay, and now?
Still loading. Yeah,
Yes,
it's visible now.
It's visible now, Prachi.
Okay, cool.
Okay, so let me know when I should start your time. Are you all ready?
Okay, you can start.
Your time starts now.
Everyone, we are starting with the fourth pillar of bioethics, which starts with the first do no harm, that is primum non nocere. This is Team Hera Fery. I'm Prachi, and with my teammates Dipanshu, Pratishtha, Neil, and Akash, we present to you non-maleficence, starting with a clinical dilemma. Please read this question carefully. A patient who has strong convictions is bleeding profusely and doesn't want transfusion under any circumstance. That can't be done, right? So the doctors actually gave him transfusion, which further led to transfusion reactions, causing the death of the patient. Do you think what the doctor did was right? We'll come back to this later on. Starting with what exactly is non. As the Hippocratic Oath rightly states, I will use my power to help the sick to the best of my ability and judgment. I will abstain from harming anyone from it. This simply implies that even if we cannot do anything good for the patient, the doctor should never practice such techniques that can cause any more harm to the patient or aggravate their suffering in any way. Direct breach of non-maleficence in clinical practice, there is an entity which we commonly call medical negligence, and there are two very important conditions to that. The professional must have a duty to the affected party, and that affected party must face some harm. Moving forward to how maleficence is in conflict with the pillars, my friend Neil here will be taking over.
Okay, so thank you, Prachi. So now I'll be briefing about how non-maleficence is in conflict with the rest of the pillars of the bioethics, that is non-maleficence versus autonomy, beneficence, and justice. So as we know that both beneficence and non-maleficence are in agreement because the first one says to do an act which leads to good for the patient, while the later says at least doing no harm if no good can be done. So it is very important for us, being the future healthcare provider, being able to reduce or eliminate the wrongdoing. At the same time, we support the welfare of the patient. Also, neglecting the undesirable or say harmful consequences resulting from any risk or complication of any disease or say surgical procedure, we tend to endanger the life of the patient, which we shouldn't do. It is very crucial for us to balance the possible harm. Best example here we have, such as unnecessary loss of limb or surgery, even due to a small lesion in the limb, and also the potential for the patient to regret in the later stages where they don't go ahead with the surgeon's decision. Also, keeping the patient's autonomy is our topmost priority, right? So what happens is we need to accept all the therapeutic as well as the surgical decision made by the patient, also even if it ultimately harms or causes the patient's life. And the best example we have here is the euthanasia in a terminally ill patient, so wherein you're causing an ultimate harm by taking his or her life. Also, what happens in justice is we are being fair to all our future patients by providing an equal distribution of resources wherever possible. So what we need to do is we need to always go ahead by following the triad system. So here we have two patients saying for a patient having a pointless course of treatment versus a patient having an emergency case, also where who needs an immediate attention. So in that case, we just need to prioritize. That is the most important thing that we need to do, because otherwise it looks like we are marginalizing a certain category of people. Also, during the COVID-19 pandemic, we have a very good example is the ventilators for a terminally ill and the other patient who's who's in the urge of recovery. So we can have more turnover rates. So that is another example. Even organ transplantation comes under this domain. So what happens is, as a clinician, it is moral and ethical obligation to not take any decision that brings any further harm to the patient or say to contribute the suffering in any way. So the ultimate course of action is for us analyzing the weighing, risk on one hand and the benefits on the other, and then going for the best interest of the patient at that specific hour. So thank you. So now I want to explain few examples which goes against the non-maleficence. So over to you, Dipanshu.
Thank you, Neil. Thank you. Thank you. So, I'll be discussing a few examples of a few clinical scenarios which we might or we usually encounter, which violate non-maleficence as a pillar of bioethics. The very first example is all of us can relate right now. We all are in the middle of a COVID-19 pandemic, and we are really, really eager for a vaccine to come out. But just think about it. A vaccine trial, which is ideally supposed to take place in 2 years, is now being rushed in just 6 months and accelerating a clinical trial. A pandemic can lead to overshadowing of long-term risks. Suppose or a very positive impact of a vaccine in good 2 years. Now I'm just rushing it in 6 months. The next example is a few colleges are calling the students for COVID duty. And it is not the right thing because a student is not as competent as a doctor who has a hands-on experience, especially treating the COVID-19 patients. And secondly, the student can be potential people to spread the infection in the community. And the last example which I'd like to mention is a patient who signs a DNR, that is, do not resuscitate. A patient who says that if I sign a DNR and if I'm going to go under a cardiac arrest, I should not be resuscitated. And that's right, because CPR is successful only in 1 out of 10 cases. But just see, just think about it. You are seeing a ship sinking right in front of your eyes, and you know all the means to save it, and you can't save it. Do you think it is right to do no harm? Are you following this? That's absolutely not. That's all about it. Now I'll carry the session forward to Pratishtha. She'll be explaining more about it. Thank you.
Thank you so much, Dipanshu. We now have a clinical scenario in a very realistic setting for all of you. The case scenario is as such: a 32-year-old male was diagnosed with chronic liver disease and operated on for liver transplantation in a tertiary care center. The donor was his wife, who was 28 years old. The transplantation was successful. However, 2 days later, due to post-operative complications, the patient expired. The patient party was misinformed about the available resources, leading to the death of the patient. Here, the resources refer to the small OT, the lack of standard laboratory, and facilities were not sufficient. Was it ethically right? No, it wasn't. To abstain from doing harm, as dictated by the Hippocratic Oath, there is negligence not only on the part of the hospital, but also the doctor. And the suffering of the negligence was on the patient, the wife, and the hundreds of patients who had come to this hospital. Non-maleficence is an important obligation in morality and medical ethics. With this, we have come to the end of our presentation. Thank you all for listening. We now open the remaining of our time for any questions from the judges and the participants.
Can I ask you a question?
Yeah, definitely.
Ma'am, you mentioned your opinion, sir mentioned his opinion on the DNR about how it goes against your pillar of justice. So do you think it's all right to violate the patient's wishes and his autonomy, even if he is terminal and, perform CPR?
Yeah, okay, you're correct. Even if we take the patient's autonomy as a priority in this scenario and we don't administer them CPR, that is correct. But you know all the means to save the patient's life by waiting. So is it ethical on your part, really?
Ma'am, I think the patient has made an informed decision on why they don't want CPR, and even after CPR, a lot of patients, the quality of life is pretty decreased. So would that be right? Because they knew what they were choosing.
Patient has a capability of making informed decisions. That doesn't mean we can take somebody's death on our own conscience. Thank you very much.
Ma'am, but being a doctor is not... Yeah,
Can I answer that question?
Yeah.
Is that Ria asking the question?
Yeah.
Hi, Ria. So I think, to side with Prachi, there are some guidelines given in the 5-judge bench judgment of the Common Causes versus Union of India, where even after an advance directive has been signed, if the doctor reasonably believes that at the time of signing of the advance directive, the patient was under undue pressure or that directive was not a free will, the doctor has all the rights to appeal in the court or to the ethics committee to actually make sure to corroborate if the advance directive made by the patient was under free will. So doctor has the right to appeal that directive.
I understand, but that was not my question. My question was in case it is the patient's free will under which he signs the advance directive, and if the doctor doesn't agree with it, can he out of his own decision act against the patient's will?
Okay, can I answer this?
Yeah.
Okay, so Indian Constitution, Article 21 says that an individual of a citizen of India, that is a citizen of India, has the right to life but not right to death. So there is nothing that is legally wrong in denying a DNR.
Actually, according to the latest amendment, Indian Constitution does include.
Sorry, participants. I will have to cut you off. The time has already elapsed and quite a while ago, so I will have to cut you off. Sorry, Prathishta, Prachi, Ria, and everyone else that was in conversation. We shall move on to the second round. Thank you for a very, very amazing and mentally invigorating round one. I'm sure we all learned a lot from your presentation. So thank you for putting in the time to actually present to us and gather your thoughts together about your pillar and give it to us in such a well-presented manner. Great job, guys. Great job, everyone. Now we will move on to the second round, that is the debate. Before we go on to the second round, I want the teams to know that if two teams are going head to head, the other two teams will be acting as the jury. Okay, one person from the other two teams, one person from each team will be acting as a jury. If there is a discrepancy in the jury's point of view, that is when Anusha and myself will step in to be the tiebreaker as such. Okay, so for example, if Team No Hera Fery is going against Team Justice League, the team from the team Antivaxers and Team Ninja will be the jury. However, if one person from Team Ninja says that the objection is overruled and the other team Antivaxer says it is sustained, that is when Anusha and I will step in to make the final decision. These decisions are not refutable. We will not be hearing any appeal against it or any objection to the decision made by the jury. Is that clear with every team that's here today? Can you one person unmute themselves and say yes?
Yes.
Yes.
Great. So with that, we will move on. Anusha, do you want to carry on?
Yes, sure, Kiran. So, as decided by the judges, I think you guys already know the first two teams that are going up against each other. That is Ninja versus No Hera Fery. So, we will be presenting the case to you. Shayan? Also, something that I'd like to add, after we present the case, like we mentioned earlier, there'll be a coin toss, and that will decide which team the winning team basically decides whether they want to be defendant or plaintiff in this case. So immediately after we read out the case, there'll be a coin toss. You can take pictures of the case while I read it. Anything is fine. So presenting the case right now. Are both the teams ready?
Yes.
Teams, are both the teams ready? Great. Thank you. Please, we expect you to reply when we ask a question. Thank you.
All right. So case number 1. This is again taken from a course book. So in late 1984, KP had cardiac surgery during which he was transfused with cryoprecipitate, a blood component intended to stop his bleeding. It succeeded in stopping the bleeding, unknown to all. It was contaminated with the human immunodeficiency virus. The gift of life proved fatal to KP, who died of HIV-related pneumonia in 1990. The blood had been collected in November 1984 from an unwitting donor, Mr. L. Now, in 1985, that is 1 year after 1984, when he received the blood transfusion, Mr. L returned to the same center to give blood a second time. By then, the center was able to test for HIV, and they discovered that Mr. L's blood was contaminated with HIV. In June 1987, the center traced Mr. L's potentially contaminated 1984 donation to the hospital where Mr. KP had cardiac surgery, and so advised the hospital. Next slide, Shayan. Shayan, can you hear me? Yeah, I can see the slide. So it was not until February 1989 that the hospital traced the blood to the 1984 transfusion given to Mr. KP. In April 1989, the head of the hospital blood bank telephoned Mr. KP's family doctor, Dr. B, and informed him that Mr. KP's 1984 transfusion may have been contaminated with HIV. By this time, the patient was already suffering from a chronic cardiac condition and was experiencing anxiety and depression. Now, Dr. B was concerned about his client's mental health and poor cardiac condition. Operating on the assumption that Mr. KP was not having sexual intercourse with Mrs. KP, he did not inform Mr. KP of the possibility that he may have been infected with HIV. Now, in 1990, Mr. KP died of pneumonia-related causes. And in April, Dr. B learned that Mr. KP had been tested with HIV. Was HIV positive. Now, in September of the same year, Mrs. KP discovered that she was HIV positive too and filed a case against Dr. B for not disclosing this information. So, as I think you can take a picture of the case, and if you haven't yet, and as all of you know, based on this case, the plaintiff here is Mrs. KP, the defendant is Dr. B. We will now have a coin toss between both the organizations. So I'd like Hera Fery to pick whether you like heads or tails.
We'll take heads.
All right. Keegan, are you?
Okay, Anusha, you'll have to share again because create transparency. We're going to be showing the toss. Okay. If I'm not wrong, Team No Hera Fery has picked heads, and we will toss now. Great. So that means
Team Ninja,
Team
wins
Ninja
the
is the
toss.
winner. Right. Right. So Team Ninja, what do you choose?
We want to be the plaintiff.
Great. Anusha, carry
Yes.
on.
So based on this, Team Hera Fery will be the defendant, Team Ninja will be the plaintiff, and you will get about 5 to 6 minutes from now to discuss your case. You can do whatever you want, turn your cameras off, take your time, or Keegan is going to start the timer. Any issues you have, you'd like us to display the case again really quickly, let us know.
Does everyone see my screen?
Yes. No, now I can't.
It's not visible.
Visible now?
Yes, it is.
Great. So we're going with Team Team Ninja first, right? Because they're the plaintiff. Give us a minute. I think we're having network issues.
So like we mentioned earlier, you'll get about 6 minutes to discuss your case. So we started the timer and we'll let you know.
I must congratulate your team. You all have done a very good job. I was wondering how this is going to pan out.
Thank you, ma'am.
Yes, very impressive. Dr. D'Souza here, very impressive.
Avinash, how are you, Dr. Avinash?
All fine, all fine.
And it's nice, they all used slightly different formats. You know, somebody used a role play, somebody used a case discussion, which was verbally given, someone used the the PPT to present the case. So that was really nice.
Yeah, it's a lot of versatility and variety in the presentations, and it was really interesting to attend to all the 4 presentations that we had. So all the best for the future rounds to the teams.
Thank you, ma'am. I'm sure the teams and we appreciate it a lot.
Your photo elocution? How did you all format the photo elocution?
So ma'am, we collected the videos and the pictures from the participants, and then we went on Google Meet and shared it with our judges. So they went through it this morning, and we will be presenting the winners along with our judges after this round.
Basically, we asked them.
The audio is splitting. I'm not hearing you continuously.
Basically, we asked them to click a photo, any photo depicting upholding or violation of human rights, and they have to record a video also, one explaining the photo. So this is how it was done.
They clicked photos and presented videos on ethical issues.
Yeah, ma'am. The photo is supposed to be of it should either uphold or violate the human right, and you should explain it how it's upholding or violating the human right. Any photo, like from the real life photo, not taken from internet or anything like that.
All right. Interesting.
Yes, ma'am.
You people seem to have put a lot of thought into this entire thing.
The brainchild behind photo elocution concept was Dr. Princey, ma'am.
Yeah, really? Wow. I think with Dr. Princey and Dr. Mary and Dr. Russell and behind it, I'm going to assume this will be an annual feature and you all will be doing this year on end.
Yes, ma'am, that's the plan as of now. Let's hope and see that it's
One suggestion to the organizers: can we can publish or compile all these pictures of the competition of photo elocution so that the others can also have an access to go through those pictures. I'm very sure that it must be interesting to see.
Yes, we can share the drive link with you, ma'am, if you're interested.
Caduceus, don't you have a Facebook page? I
Yeah.
select a Facebook page with Caduceus.
We do, ma'am. We do have a Facebook page. Shayan, do you want to talk about it?
So no, what I was thinking is perhaps these things, the links could be put up on that Facebook page for people to know what all you are doing in different areas.
Right, ma'am.
I remember seeing your Facebook page during the med education that you all had done 4-5 years back.
We actually just finished our med education in the month of September.
Yeah. My daughter was with Caduceus from 2012 to 2016, I think.
That's really
She
nice.
was vice president this and I've got vice president that. And so I remember hearing so much about your Caduceus. You all do really good jobs.
Thank you, ma'am.
What's your name, ma'am?
Shweta Sharma.
Was she in MGM?
True. Yeah.
So yeah, she's one of my friends.
Friends. Okay, small world. Good job.
Thank you, ma'am.
A reminder to both the teams, you have 1 minute left for your discussion.
Okay, teams, your time is up. We'll start the 3-minute timer now.
Yeah, as the plaintiff, I go first, right?
Yes.
Okay.
Okay, are you done? I mean, are you ready? Sorry.
Yeah, I'm ready.
The time starts now.
We, Team Nanja, are here to act as plaintiffs and represent Mrs. KP. Here, our allegations are as follows. In 1984, the blood was taken from Mr. L, who must have shown symptoms of AIDS at this point, and that was not noted. We would like to consider this corporate negligence, following which, in 1985, again, the blood was not screened. At this point in 1985, whereas we would like to make note that the
Objection.
AIDS training.
Hearsay.
Okay, in 1980. Yeah. So is it
on
sustained?
On what grounds?
Grounds that the Mr. L was suffering from symptoms.
Okay, jury from the teams of Justice League and Antivaxers. What do you rule on this objection?
That's accepted. Sustained.
Okay.
Great. So with that, both the teams say sustained, right? Anti-vaxxers and Justice League.
Yes.
Okay.
Yes. Akash, you may continue.
Okay. In all cases of medical negligence, the plaintiff has a direct all burden of proof to prove all the parts of a medical negligence. In Dr. Jacob Matthews versus the State of Punjab, a 2005 three-judge bench Supreme Court judgment, there were three main things that the plaintiff needs to prove in order to show that there has been any corporate negligence which the plaintiff was claiming, right? So first of all, what's the first thing that needs to be proved? The plaintiff owed a duty to care to the defendant owed a duty to care to the plaintiff. In this, the defendant was Dr. B. The plaintiff was
Objection.
Objection.
May I? Is that
on what grounds?
leading? Sir, I was talking about objection on the initial stage in 1984. I haven't even got into the doctor yet. You cannot quote a case on that yet.
Just to add, I don't think he was quoting something you said, but we will still move it to jury. Yes, we will still move it to jury. Jury, what do you have to rule on this?
That's overruled. He was quoting the case.
No, in respect to my.
Anti-vaxxers.
Sorry.
Overruled from anti-vaxxers. What does Team Justice League have to say?
It's overruled from our side too.
Okay, so that objection is overruled.
Before I start, how much time do I have total?
1 minute 49 seconds left.
No, about like okay, so I'll have 2 minutes 49 with my extension of 1 minute.
Your extension of 1 minute? No, wait.
So you
Because
get
Ria's
the time plus 3 minutes. That is your 3 minutes next. So her remaining time, that is, I think she stopped at 1 minute something. So we've been we continued the timer of hers.
Right. So no. I was asking whether the objections extra time is added right now.
No, not yet. You will be getting a fresh 3 minutes.
Right. Coming to the three main points of the main things that needed to be proved in a negligence. First of all, the doctors owing a duty to care. Second, whether there were damages done to the patient. Thirdly, whether there is a direct.
On what ground?
He says that the damage was done, but done to the patient, which was recognized 6 years later. So we cannot come to conclusion within the first year, and we cannot just come and say anything for the first period of 1 year.
Okay, jury, that comes to you.
But I think that again derived from the case. When you he's explaining the case to you, and then he's giving you three
what is supposed to be considered. So you should like listen before second. I think that'll be overruled from our side. Sorry.
Okay, jury, please refrain from giving other opinions other than your ruling. Just give your ruling, and we will move on to Team Justice League. Overruled. Great. So that objection stands overruled. No, Hera Fery, you may continue.
Oh, great. So to prevent any further overruling, I'll take it a bit slow. Right. So I was telling that there are three things that are needed to be proven on your side. So first, hear me out. So first, I told you there is a duty of care. Second, that needs to be proved on your side is that there were damages done to the health or the mental health or any physical harm done to Mrs. KP. Third, you need to prove to the court why there is a direct correlation between the act of the doctor and the harms done. Right? All three need to be proved. So hear me out on the first part. Firstly, the defendants feel that the doctor owed absolutely no duty to care to Mrs. KP, right? Even if the jury somehow assumes or judges assume that the doctor owed a duty to care, we come to the second point and defend it one step further. We tell you that this damages that are done to Mrs. KP need to be proven on their side.
Objection. Yeah.
On what ground?
Relevance. That
relevance, yeah, because here the defendant is supposed to, prove, as in explain the doctor's stand and not explain what was owed or what was not owed to Mrs. KP in this case. And I think Manashwi would like to add to that.
Yeah, so basically the doctor does not have, even if the defendant says that the doctor does not have direct, he does, because which is a communicable disease, and if one person, if the husband gets the disease, if the wife is bound to get affected with it because of all the natural reasons. So thus I say that it is not relevant to say that the doctor is not bound to the wife.
Moreover, he assumed that they are not having sexual intercourse. But HIV doesn't mean that it will be transferred only through sexual intercourse. It can be transferred in many ways. So this is our objection.
Also, ma'am, relevance, because he is talking for our side and he has not got to defending the doctor yet.
Okay, after hearing your arguments, Team Ninja, we will go to the jury. Jury from Antivaxers, what do you have to say? I can't hear you, Antivaxers.
Sustained.
Sustained, thank you. And from Justice League?
Sustained.
Great. So,
Judge, there's a question from my side. To which 4 points was the rule sustained? Like there is 4 different points to object me.
Sorry, Keegan told that you can't question the jury.
Can we not dive?
I'm questioning Keegan, like rules of procedure, like as a point of inquiry.
You mean a point of inquiry would not stand here, but okay. To which of the 4 points I am unsure, because it was something that it was not a ruling that I passed, it was the ruling that the jury passed. So you can ask them after the round. But with that, we will give 30 seconds back to Team Ninja. Team Ninja, you have 30 seconds.
In 1985, antibody test for HIV was confirmed, and the admitting hospital where the surgery was performed did not bother to test the infusion blood or the cryoprecipitate. In 1989, again, when the doctor received information, he did not convey this information to the patient, which ultimately led to his death 6 years later and his wife being infected with HIV. Also, the wife here, our plaintiff, would like to plead on the basis of Section 304A and request 2 years prison sentence along with a fine.
Okay, so with that, we're done with your time. Thank you, Team Ninja. Anusha, do you want to add something?
Yeah, now when we come back to Hera Fery, as all of you know, Hera Fery already has 3 points to make, 3 minutes to make their point. But in addition to that, they get 2 minutes because the other team was overruled twice. So 1 minute, both times were added to Team Hera Fery. So now Team Hera Fery gets 5 minutes to put forth their point.
Point of inquiry.
Yeah.
We raised objections. Do we get extra time because they were sustained as well? Or is it only a remainder of the time was
Sustained, their time gets shifted to you, like we mentioned earlier. If it's overruled, they get an extra minute.
Okay.
That's for the rules, yeah.
Sure. Thank you.
So
Team No Hera Fery, are you good to go? Is that a yes?
Oh, sorry. Yeah, I was muted. Yeah, you can go ahead.
Great. Your time starts now.
Okay. So coming to the 3 points that I absolutely hear no points from the proposition side because unfortunately our objection took over. So I was telling that there are a few things that you needed to prove in the 3 minutes, right? So it is quite relevant to this argument because the defendant has the right to tell the judge what the opposition's burden is because that is what the opposition
Objection
needs to the
relevance. The defendant is again engaging in telling what the plaintiff needs to prove and not proving their case at all. And again, they are constantly referring to the objections and not making their stand very clear. So I would like to object on the grounds of relevance.
okay, moving to anti-vaxxers and anti-vaxxers, what do you have to say?
In my personal case, so
okay, overruled. Now the next team, that is
Ninja, I think.
Okay, it's overruled from our side too.
all right. Thank you, Justice League. Yes.
Oh,
so you can continue.
Okay, so that's overruled.
Yes, and you get 1 more minute extra now.
Right. So I think it's quite clear I can talk from your side as well. So please don't object it further. You'll lose time. So so what I think was what the lawyer on behalf of my client would tell to the judges that first of all, even though one of their objections came that the doctor owed duty to the public, but here the plaintiff who has sued the doctor is not the state but rather the person in his personal capacity. Therefore, whenever there is a personal lawsuit, the state cannot intervene, or the person who is suing the doctor cannot claim that the state would add harm because it's suing them in their personal capacity. It's a civil suit.
Objection.
In a civil suit, there is
on what grounds?
Factual
Objection relevance, factual error and relevance.
Please explain.
Sir,
So-
not. Yeah, sorry. May I?
Go ahead, Ria.
The plaintiff is not suing the state, sir. We're trying to sue the doctor who you are defending. It's a factual error.
Adding
we'll
to
take
it,
that
it
to-
also means that the defendant clearly stated that the state does not hold responsibility of an individual lawsuit, personal lawsuit, which is not correct. If the lawsuit in longer heads comes under the purview of affecting a state or more than one entity, then the state definitely has a role to play.
Do I have a
we take
right
that-
to reply to that?
No, we do not have right to reply. First of all, it never dealt with anything with regards to your sovereignty. So we'll take that to the jury, Antivaxers and Justice League.
Okay.
It's sustained from our side too.
Great. So that we have two rulings of sustained. So Team Ninja, you have 3 minutes, 32 seconds. You may begin now.
As I was saying earlier, in 1989, when the doctor received information about the HIV positive blood being transfused into the patient, it was privileged communication that he informed not only the patient, but also my plaintiff, which is Mrs. KP. And with this information...
Objection.
On what grounds?
the term privileged communication means actually hiding the information
On what
in the better
grounds?
interest.
On what grounds?
On the grounds when the person who was speaking mentioned that it's a privileged communication, but the
Yes,
term
but what
privileged
grounds does it
communication.
fall under?
Oh, sorry. On the grounds of relevancy.
Okay, now you can explain.
Okay, so my objection is that the doctrine of privileged communication tells us that the doctor has the right in order to hide some information so that it's in the better interest of it's not necessary to breach the confidentiality.
Okay, so are you saying that
Okay, we're not no crosstalk, delegates. No crosstalk. I'm sorry. I'm sorry, no crosstalk. We'll take that to the jury. Jury,
That should be sustained.
sustained. Justice League. Justice League.
Overruled.
Yeah, overruled.
Great. So we have one suspension and one overruled. That leaves it to Anusha and me. Anusha,
I'll leave it to you.
I will overrule this. I will give you an explanation of why I overrule it later, but for now it's overruled. So this objection stands overruled. Ninja, continue.
As I was mentioning, it as an exception to privileged communication because HIV being a communicable disease, it is a notifiable disease and the spouse has every right to know in case the patient doesn't do it himself. And in this case...
Objection.
On what grounds? On what grounds?
On grounds of irrelevancy.
On grounds of relevancy, you mean? Yes. You want to explain why?
I'm sorry. I didn't catch that. I'm sorry.
Is it a doctor death?
Is it just or can we not?
I can't hear. Sorry.
To
Sorry.
Is it okay now?
Prachi, your voice was not audible. Maybe you can turn off the camera.
Yeah.
Okay, right.
Yeah.
Turn off and you can speak again.
Okay. Am I audible now?
Yes, you are.
Yeah.
So I objected on the grounds of relevancy because that it was a notifiable disease, so the doctor owes a duty to inform the spouse, which is wrong. The term notifiable disease only means that the doctor has to inform the certain authority that there might be a case of epidemic spread and no duty to the spouse, because we won't be breaking our code of confidentiality here to not inform any person other than the patient about their condition even after death. Hello?
Okay. I will take that to the jury. Jury.
That should be
sustained from team.
Hello. I'm back.
Antivaxers. Wait.
Yes.
Ninja, wait. We've taken it to Team Ninja.
No, I'm sorry. I didn't hear what happened. I lost connection. Can I know what the objection was?
The doctor actually owes no duty of care to the wife, because KP's wife, because the doctor, you mentioned the term notifiable disease, which is actually a factual error. The term notifiable disease means that the doctor only owes a duty to inform the government authorities of a possible epidemic spread in an area and not to any other person other than their patient about their condition, which is why the code of confidentiality is not violated even after the death of the patient.
I understand.
Can we have an objection over an objection, please?
No, you can't.
We cannot have that. Sorry.
All right, so
we'll take that to the jury. Let them decide. Antivaxers?
That should be sustained.
Antivaxers says it's sustained. We come to Justice League.
It's overruled from our side.
Great.
Yeah,
that leaves
just a second. Could the team who's objecting, could they first mention what is their objection and then the explanation? Because it's not clear what exactly their objection is. They're
their
just
objection
giving a
on the
huge.
ground.
I would may I intervene, please?
Yes, please.
Yes, ma'am.
I would request anybody making an objection to please state the statement to which you are objecting, on what grounds you are objecting to it, and only then pass it to the jury and let the jury make a decision, because an entire paragraph and a concept being objected to is very different from a statement being objected to. That would kind of speed things along.
Yes, ma'am.
Yes, ma'am. I agree. So with that, we have one suspension and one overrule that goes to the jury. Jury, do you want to decide whether we sustain this or overrule?
I think we should sustain that because
No, not the student jury, not the student jury, the faculty jury. You've already given your ruling, right? Thank you. Judges, is that sustained or is that overruled?
Dr. Avinash, Dr. Sonali, if we could just confer on WhatsApp, that would be fast.
Right, ma'am. On the WhatsApp, it will be done.
Okay, seeing that two of the judges out of all three have sustained it, we will give it to Team No Hera Fery. Team No Hera Fery, you have your time, which starts now.
Okay, thank you very much.
Prachi, are you going?
Yeah, I'm going.
Okay, go.
Okay, so as repeated earlier, ma'am already mentioned here the term notifiable disease as a very something very wrong in medical terms, and let us kind of overlook that for a minute. But here the doctor still doesn't owe a duty of care to the wife because the patient was Mr. KP and not their wife. Furthermore, in the span of
Objection
6 months.
What statement, Team Ninja?
Statement, the opponent defendant just said that the doctor does not owe a responsibility to the wife but to the patient. Here in the case, the duty is to the patient, so even the patient was never informed. So relevance.
Okay, on the grounds of relevance and the explanation that you gave. Jury, student jury, that is Antivaxers and Justice League. Antivaxers? Sustained and Justice League?
It's sustained from our side too.
Great. So with that, we will give the remaining time to Team Ninja. Team Ninja, your time starts now.
Thank you. So basically, we were at a point stating that it is something that everyone should be notified, the state or the individual also, and because because the plaintiff is also directly related to this current scenario, we should be able to the doctor should be authorized or should be liable to inform the patient and her wife, because both of them are equally at risk right now, and we're talking about a very communicable disease.
Objection.
And it can create an epidemic.
Objection.
Good statement.
The point where she said that the doctor owes a liability to the patient as well as the spouse because it could create an epidemic.
Okay, so on what grounds?
Relevancy.
Okay. We'll pass that on to the jury. Jury from Antivaxers, what do you have to say?
that should be sustained.
And jury from Team Justice League, what do you have to say?
Sustained.
That is a sustained objection. Then we will give it to Team No Hera Fery again. Team No Hera Fery, you have 1
Prachi,
minute,
let me
51
go,
seconds.
please.
Your time
Yeah,
starts
okay, Akash
now.
can go this time.
Right. Coming to the facts of this question, this problem statement. It's written that by the time the patient was already suffering from a chronic cardiac condition and was experiencing anxiety and depression. Let me quote the principle of therapeutic privilege. The doctor, in acting in his best interest of the patient, can actually refrain from telling information to the patient that can have an adverse effect on the patient's mental health.
Objection.
There was an objection. Objection to which statement?
Leading. He mentioned the patient has a cardiac problem and depression, and that was grounds for not giving the patient information.
Okay. And on what ground? Okay, you gave the grounds, right? We will pass it on to the jury. Jury, what do you have to say on this?
We gave an explanation.
Overruled from Antivaxers, Team Justice League. Overruled from Justice League. Okay, that's great. No, Hera Fery, you have 1 minute 23 seconds. Your time starts now.
Right. So what I was mentioning, that the doctor has the therapeutic privilege to actually withhold information which can actually be harmful for the client, because the patient presented to him with was already suffering. Therefore, the acting in the best interest of the patient, the doctor can withhold the information. Coming to a second part, let's look at the first statement.
There's an objection on which statement?
Statement that he says the doctor can withhold information for the benefit of the patient. But the explanation here is that if the doctor is withholding information regarding a communicable disease, which will in future affect the life of the patient as well as that of his wife, the doctor cannot withhold such grave information. If yeah, that's my point.
Okay.
Sustained.
That we will pass over to the jury. Jury from Antivaxxers says sustained.
Sustained.
Jury from great. So
what was the grounds? I think she didn't mention the grounds.
May I add to that?
So we
Yes,
already
Riya, go
have
ahead.
2 suspensions. You don't need to add to that, Riya. We have less time. Manashri, if you could just add on what grounds you objected.
I said relevance. I said relevance, and I stated the statement and my explanation.
Okay, thank you. The jury has already given a decision, so we won't waste more time with that. Team Ninja, you have 1 minute, 1 second. Your time starts now.
So basically, we were at a point where we stated that the doctor should have informed at least when the patient came back in 1989, when the hospital traced the blood to 1984 transfusion. So at that point, at least when the thing came out, the doctor should have informed the state as well as the patient, because his life was affected, and because of his life
Objection.
being affected.
Irrelevant. The facts of the case clearly state that in 1984, the transfusion may have been contaminated. According to the Supreme Court guidelines, which state for medical negligence, the point clearly states that negligence cannot be established by the prosecution when it is made on the judgment of the doctor. In this case, the doctor made a call of judgment.
Pratishta, could you just elaborate on what statement of the other objection?
The plaintiff clearly stated that the doctor should have informed because the doctor was liable in 1984 because the transfusion came back saying that it was contaminated. However, the facts of the case say maybe, which is a point to be noted.
Okay, thank you, Pratishta. We will give that to the jury. Judy, what do you have to say?
Sustained.
That's 1 suspension. Justice League.
Overruled.
I'm sorry, did I hear overruled?
Overruled.
It said overruled.
Great. So with that, we then have a contentious objection. We will move on to the judges. Judges, what do you have to say? We have undecided thing with the judges as well. Avinash sir, we're waiting for your. Dr. Avinash sir.
Dr. Avinash, sir, are you still on call with us?
I don't think he's there right now.
You can also take a poll if it is possible on the chat.
Poll would be very biased because we have people from all
Yeah.
organizations here.
Okay.
So if the judges could just decide.
Why don't you let one of the senior faculty take the place of Dr. Avinash on this particular call so that it can proceed?
Yes, ma'am. We can do that. We can either invite Mary, ma'am.
Yeah, if Dr. Mary could just help us out here, that would be really nice.
Dr. Mary, do we have you? I don't think we have Dr. Mary. Do we have Dr. Prince here? Okay, we do not have Dr. Princey. Judges, if you all could come to a decision, I think that would be the best. Now.
Should I clarify my point once more?
That would be good.
Okay. So the plaintiff clearly mentioned that the doctor owed liability to the patient. However, in 1984, when the other doctor informed the family doctor, which is Mr. KP, it was clearly mentioned in the case that it may have been contaminated. The may is a point to be noted, as according to the Supreme Court guidelines, the point 2 clearly states that negligence cannot be established based upon an error of judgment. It was a judgment call which was taken, considering the therapeutic privilege that the doctor has.
Take the call from the student jury again, if it is possible.
Only if the jury could allow objection over an objection, we would have clearly stated the factual error that they're making.
Sorry, we do not.
Ma'am, Shilpa ma'am, is it issue a ruling?
That's right. I think we can proceed with the ruling.
Okay, so have you changed your ruling to overruled, ma'am?
That's right.
Okay, thank you. So with that, the objection stands overruled. Team Ninja, you have time, 32 seconds. Your time starts now.
Thank you. So it is clearly mentioned that the tracing back from the blood bank was done, and this informed Mr. KP's family doctor, and because of his operating on the assumption that Mr. KP was not having sexual intercourse with Mrs. KP, he did not inform Mr. KP. Hence, the plaintiff has full grounds to state that negligence was done by Dr. B, and clear statement or action should have been taken. We urge the court to pass a judgment of 2 years of fine on the grounds of sanction.
Thank you, Team Ninja. With that, we finished the first round. It was very, very hectic and great job, teams. Thank you for keeping us all so engaged and at the edge of our seats. We will move on to the second round. So for the second part of the second round, each team will have 1 minute each. So For example, Team Ninja goes for 1 minute, followed by Team No Hera Fery that goes for 1 minute, and after which we will be having a 6-minute round of back and forth. Is that understood?
Point of inquiry.
Tell me.
There is a continuous overruling and suspension of objections. So will the time be calculated for that as well?
We are going to be limiting our objections in the final round because it went a little overboard in this round. So don't worry, we are
And
taking that into consideration.
no, but
And
the
we
point
have, whenever there was
the point that I think Manasvi is trying to clarify is that Anusha did mention that when a lot of our objections got overruled, right? The other team was given extra time. So now a lot of their objections also were overruled, right? And we didn't get the extra time. Like we didn't give as much as them. They got 2 minutes extra. So that's unfair for us, is what Manasvi is trying to say, I think.
Yes, thank you, Chetna. That's exactly what I meant.
Okay, so based on the extra time, I think we gave them 2 minutes extra for overruling, and we gave them the remaining time from yours for when it was sustained. So based on that, we'd actually like to take this to the judges because we've, of course, done this for a really long time in the first segment. So we'd like our judges to let us know if we should equate it by giving the other team 2 minutes for the remaining objections, or if we should move to the next round, bearing in mind that it's already 1:15.
I think perhaps for this particular session where you are going to be refuting 1 minute, let's keep objections only for the initial 3-minute talk, and that should be limited to a conversation within a 6-minute period. So you have a total of 6 minutes, which you have equally divided to two teams of 3 minutes each. And based on how many objections they are able to interject and win, they would get their share of a total of 6 minutes.
Okay, ma'am.
So that would kind of limit the time period. And when you're talking about the 1 minute interactions, I think they can refute each other in the 1 minute that they are given. So they don't have to put in an objection. They can use their 1 minute to place forward their objection. So that would finish it in the time you have planned. I mean, it's open to discussion if anyone else has something better.
Yeah, and I
I
would be
think we'll go with-
requesting, yeah, right. And it would be better if there is some concrete like reason for objection, for raising an objection with the proper statement, which ma'am has rightly mentioned in the previous year, with the statement and with the criteria for the objection should be followed.
Correct. So delegates, please note that all objections will have this particular order. You will have to quote what the other person said, what you are objecting to, then followed by what grounds you're objecting, and then give us an explanation of why you're objecting on those grounds on that particular statement. Okay, so with that, we will move on to the next round. We won't be entertaining. Yes.
I strongly feel the case is not really building up. So you should allow the Nina or whoever the team is to at least 1 minute of protected time or 20 seconds protected time to build a case up.
May I say something here? May I say something? The onus of building the case was on their ability. If they have been unable to do that, it's not the job of the jury or the judges to help them to do that. It's their ability or failure to do that. Right? So I think we take it from there.
I agree. I totally agree with ma'am.
Thank you. So for now, what we are doing now is we're giving each team 1 minute. We're not entertaining objections in this round. Okay, did everyone get that? We're not entertaining objections for this 1 minute. It's going to be 1 minute of pure Ninja and 1 minute of pure Hera Fery. With that, I will hand over to Team Ninja. Your 1 minute starts now. Team Ninja, here you are.
Just a second, the team is not in place.
Okay, so Team No Hera Fery, do you want to start first?
Okay, we'll go ahead with a 1 minute time then.
Okay. So team No Hera
Pratishtha?
Fery, your time starts
I
now.
think let them give let the opposition have their 1 minute first, and then I'll go.
Okay, that works too.
Guys, sorry, but there's some network connection issue. So just a minute until the teammate gets back.
So Akash, if it's okay, can we go?
While we are waiting for Ninja, can I make a request for the next for the final round?
Yes,
The
ma'am.
organizers, if you can just give me permission to make a certain suggestion.
Sure, ma'am.
I think the kind of objections that are made must be well thought out. In the sense, they should have some firm grounds. If a team is repeatedly getting their objections overruled, it shows a lack of thought. So can we put in some kind of a rule to the effect that in a 3-minute session, if 2 overrules happen for your objections, no more objections should be allowed. Or maybe you could put it a limit of 3 overrules. But there has to be a lid of overrules. Otherwise, you're having 5 overrules for a 3-minute session, which dragged it on endlessly. I think it doesn't really reach anywhere. That's why the story is not building up as I think it was Katyani or I don't remember. I think it was Katyayani who said that the story is not building up because so many interjections don't allow a case to build up.
Right, ma'am. So we will take that into consideration. We will limit the objections to 3 objections in the 3 minutes. That's the maximum a team can object in the 3 minutes. And if you have more than 2 overrules, you are disqualified from creating any other objections. Is that clear? Not disqualified from the debate, but disqualified from raising any other objections. Have I made
Yes.
myself clear, teams?
Yes.
I assume that will only be for the final round.
Yes, ma'am.
Yeah, thanks.
Okay, is Team Ninja here? Because we are
Yes.
running horribly late on time. Okay, Team Ninja, your 1 minute starts now.
First, I would like to start by presenting Mrs. KP's case. Here, she's lost her husband and she's contacted AIDS. Also, as the defendant mentioned, the 3 points to make it a case of negligence. The duty of care. The doctor did have a duty of care towards the patient who is now dead because of complications of HIV leading to pneumonia, and also duty to have informed Mrs. KP, which he did not do, which has led to her now contacting HIV. Next, the damages. Mrs. KP has received both emotional and physical damages. Emotional in the sense of loss of her husband, and physical in the sense of her contacting HIV now. Also, the act of not conveying information and therefore not leading to intervention, which could have saved Mr. KP's life and prevented Mrs. KP from gaining a potentially deadly disease, which could also lead to fatalities in the future. The doctor, I believe, is liable for compensation and jail time. Thank you.
Thank you. With that, we end with Team Ninja. Team No Hera Fery, your rebuttal. You have 1 minute that starts now.
Firstly, we'd like to ask the plaintiff to please read the case properly. The plaintiff stated in their rebuttal that the patient died because of HIV. To point to note that the patient died because of pneumonia causes. That means that the doctor did act in a timely manner. There's no way for negligence of the doctor to take place. Secondly, according to therapeutic privilege, the patient was suffering from mental illness and chronic cardiac condition. It was up to the doctor to make a call of judgment to decide that the patient should not be told. Thirdly, there is no direct damage which is proved by the plaintiff that the Mrs. KP had HIV because of Mr. KP. Considering that Mr. KP died in March and the HIV result came out in April, causing 6 months of time, there is no proof by the plaintiff that there was direct harm or direct damage done, which removes the clauses for medical negligence to be proved. That are the 3 points. Duty of care we followed, treat timely was followed, and we did watch the patient. I rest my case here.
Thank you. We've done with your time as well. Now we move on to the last part of the first round. That is your rebuttal round. By the discretion of the organizing committee, we will limit it. We said 6 to 8 minutes, but we will limit it to 5 minutes because we have short time majorly. So I hope that you are adjust in that. I do not know what's happening.
Yes.
Okay, your time starts now.
So,
Okay,
from the side of plaintiff, we need to point out three major things first before we begin on to the rebuttal. That the defendant has clearly made factual errors and relevancy errors throughout their conversation.
Sorry,
By saying that Mr. KP had not contacted HIV. Sorry, the last line says that Mr. KP was tested positive for HIV. Secondly, Mrs. KP was directly affected because of the same, and there has been negligence from the side of the doctor because of their assumptions. Hence, the defendant is completely at fault.
Right.
Moreover, the patient.
Coming to the point of
You are questioning the wife that did she get the HIV from her husband. This is ethically very wrong thing. Traditionally, you are asking a very wrong thing. Wife has got that HIV
In a
from
court,
the very
there is no
point of
place for traditions. Let us
Traditionally,
sustain
also
the
you
argument
mentioned
that
from March to April, according to the calendar, April
Delegates, I will have to mute all of y'all if y'all do not pay attention to the rules. There is a moderator in this session. Please respect that moderator and understand what the moderator is saying because the moderator is responsible for time at the end of the day. Okay, plaintiff, we heard your side. Now, can we move on to know Hera Fery?
Right. So, firstly, the doctor made a right judgment when he restricted the information. Second thing, the doctor assumed. Why did the doctor assume that there was no sexual intercourse occurring between Mrs. and Mrs. KP? And this is a groundbreaking argument. Is because the patient was suffering from depression and anxiety, and it's fair to assume that in such a state of a mental health, the Mr. KP will not be having sexual connections with Mrs. KP. Therefore, the burden shifts on Mrs. KP to prove that there was sexual intercourse that happened. And secondly, coming to the point of this criminal negligence, which she was mentioning about section something. Let me tell you, in a criminal negligence, the burden of proof is even higher. They need to tell that there was a gross disregard for life, in which case, if there wasn't any gross disregard for life, and not disclosing any information cannot be a grounds of a criminal negligence. Therefore, we clearly absolve the doctor of the criminal negligence charges.
Team Ninja, your rebuttal.
Yeah, here you mentioned that the part of sexual intercourse and depression. So I think that calls for speculation. The doctor is not allowed to make any assumptions on the patient's lifestyle. Also, you mentioned as he had depression and cardiac problems, he was not informed. You said therapeutic privilege or whatever you call it for the doctor. I don't think that accounts for not telling a patient he has a disease such as HIV just because we assume or we speculate that it might have harmful effects. We did also pneumonia is a known complication of HIV, and we would like to ask for expert opinion on the same as to the cause of death and autopsy reports as well. Also, you said that Mrs. KP tested positive after only 6 months after, but that does not define any contact history. Mr. KP was alive for 6 years after his operation. So, yeah.
Okay. Team No Hera Fery, your rebuttal.
Moreover, the section 304.
We'd like to state that the
Sorry, Tegan, I want to ask one thing. Is and distribution? No, we can't speak, right? Is there like plaintiff and then this waiver and
can we go and reply?
So, there is no nothing. So we can.
Sorry, but the defendant's turn to rebuttal to what the plaintiff said.
Yeah. Okay, fine.
Nancy. So now it's a chance for the defendant to rebut.
Okay, fine.
Yeah. Go ahead.
The plaintiff clearly mentioned in their cause that 6 months cannot be a point of contact history. We'd like to use that point that there is no direct damage done by Mr. KP to Mrs. KP, which states that because of Mr. KP, HIV was caused. The doctors are not medically negligent. We would like to ask for proof as to how the 6 months contributes to contact tracing. The plaintiff themselves stated that it does not.
Right. Adding to what Pratishtha mentioned, in a case
we will not to adding. Pratishtha,
okay.
finish her statement. Ninja.
Yeah, okay. So Article 304A clearly mentions that any negligence which is done by the doctor any negligence which is done by the doctor, and if causes any harm to any person, then doctor is liable for that. Section 304A. Please go and check it. It clearly says any death, or we are not saying that death was responsible for the HIV or not. We are not saying about that. We are talking about Mrs. So she got HIV just because of her husband. It's clear. We are not going to question how she got it, because this is traditionally wrong. We can't ask a wife that did you get HIV from your husband or from anyone else. This is not correct. We can't ask them. So negligence is done here clearly. Negligence. He didn't tell the wife that your husband is HIV. He didn't inform the authorities that there is
Can I
HIV
reply?
patient in the there is a HIV patient in the community. You should have told that. The doctor must be informed. State he didn't inform the state too.
Can we reply, please? Let us
Yeah,
reply.
okay.
Right.
Reply,
so,
please.
Yeah. So first of all, it's a wrong assumption to make that Mrs. KP got it from Mr. KP. Second, please, IPC section 93 says that communication made in good faith. No communication made in good faith is an offense by reason of any harm to the person to whom it is made. If it is made for the benefit of that
Sir, there
person.
are exceptions to
Understand?
that communication for this very
I'm sorry, we are being
Understand,
interrupted.
understand that section 304A talks about culpable homicide not amounting to murder, rash or negligent action, that a person should be
Your
liable
time
for a
is up.
rash or negligent action. I don't
Your
think this is
time
a
is
rash
up.
or negligent
Thank
action
you.
where case fails.
Thank you. Thank you, both teams. That was a lot of volume and a lot of information as well. Thank you for sharing and thank you for participating so enthusiastically. Anusha, do we want to move on to the next two teams or do you want to do the photo elocution results for now?
Please move on to the next two teams.
Okay, ma'am, we'll do that.
Move on, because we are already getting delayed.
Yes, ma'am. The next two teams, Anusha, do you want to introduce them? Okay, Anusha, when you are online, take over. But for now, the next two teams are Team Antivaxers and Team Justice League. Again, I would like to remind everyone that now the jury changes. The jury becomes Team Ninja and Team No Hera Fery. So make sure that you'll have one person representing your team as the jury. Do you understand? Anusha, do you want to present your screen so that we can see the second case? Anusha, I can't hear you. I don't know if you're saying.
Keaton, can you see the screen?
I can see your screen, yes. Can we go to case 2? Great. Okay, so case 2. Teams, are you ready? Are you paying attention? You can take pictures of the case if you want to refer to it later. I'm going to start reading it out. So the second case we have, on April 18, 2003, Miss X got into an argument with her live-in partner and was stabbed with a knife in the lower right side of her back. She was transferred to the National Hospital. The doctor in charge examined Miss X and found that the stab wound on the lower right side of her back was about 3 centimeters long. Moreover, her clothes were extremely blood-stained. The doctor explained to Miss X that her urine needed to be tested for blood to determine whether the stab wound had punctured the kidney, but she adamantly refused to have a urine test. The doctor finally decided to perform a procedure in which he could anesthetize her and then sew the wound up in order to stop the bleeding. The doctor explained the procedure to Miss X and told her that a urethral catheter would be inserted in her body. Miss X received an anesthetic injection without showing resistance. While Miss X was under the influence of the anesthetic, the doctor collected a urine sample by inserting a catheter in her body. Although the collected urine sample did not contain blood, the doctor suspected that Miss X was under the influence of drugs. He therefore conducted a simple drug test and found a positive reaction for amphetamines. In the meantime, Miss X's parents had come to visit her. The doctor explained the extent of her injury to them and informed them that stimulants had been detected in her urine sample. The doctor further explained to Miss X's parents that, as a national public officer, he had to notify the police of this fact. The doctor then notified a police officer that stimulants had been detected in Miss X's urine sample. Miss X filed a case against the doctor for breaching confidentiality. We have two sides here, the plaintiff, that is Miss X, and the defendant, that is the doctor. Anusha, do you want to take the coin toss?
Yes, sure. So can Justice League call what they'd like?
Tails.
Tails, all right.
So we will be Team Justice League has said tails. We are flipping the coin now. Okay, it's heads. So that means Team Antivaxers are the winners. Team Antivaxers, what do you choose, defendant or plaintiff?
We'll take 10 seconds if you're all right with that. We choose defendant, the doctor.
You all will choose defendant, that is the doctor. Great. So now you will have 5 minutes to read the case or to understand what you're going to be doing. Setting the timer. The time starts now.
Maybe you could share the results of your photo elocution competition in this 5 minutes.
Yeah, right. This time can be utilized. Anusha,
Yes,
you can go ahead. Yeah.
Do we have Dr. Princey ma'am with us?
Dr. Princey, ma'am? I'm sorry, Dr. Shimpa, ma'am, just give us a moment. We'll get Dr. Princey ma'am on board.
No problem. It was just a suggestion. But it's interesting how the other two teams dealt with the argument. They were both arguing on the same grounds, so that was very interesting. I don't know whether you're not listening to me.
Yes, ma'am. Thank you so much for your feedback.
You know, one of you was objecting to speculation on the grounds that no sexual relationships happen.
Yes, ma'am.
And on the same place, you were assuming that the wife got it from the husband. So that's as much a speculation as this is. And I'm surprised nobody brought up the fact that he was infected in 1985 and the doctor came to know about it in 1989. The wife would have got it in 4 years. Why is the doctor responsible for the wife getting it suddenly because he knew for 6 months before the death? So you're not able to prove beyond doubt. I think you'll have that phrase, right? It has to be proven beyond doubt. So it could be it could be suspected, he could have been contributory, but he would not have been proven beyond doubt. Yeah. And another thing is, you know, when you discuss these things on a legal ground, always remember there is a balance between intent to harm and an error of judgment. Yeah. So if you have an intent to harm, then even a minor error of judgment is not acceptable, or it's not, you know, entertained. But if there is zero intent to harm and then there is a error of judgment, the balance changes. So there are some interesting aspects to this case you all did. Well done, both the teams.
Yeah, and I appreciate the knowledge they had and the information they discussed about the various laws, legislations, and the sections, particularly with regard to the case. So it was really very much entertaining, and it's really a good experience to hear the discussion of both the teams.
I fully agree with you, Dr. Sonali. Only you really did too many of those sustained and overrules.
Yeah.
Nice little less. And there was one more point that struck me, and that is when you're in a court of law, you cannot use tradition as an argument when you are implying criminal negligence. Yeah, the moment you use the word criminal negligence, then it's all about evidence and proving beyond doubt. And so then tradition really doesn't contribute to the overall argument.
Right. It all comes under CRPC, Criminal Procedure Code.
Yeah, so true.
Thank you for the input. I think the next two teams will keep that in mind as well.
Excellent.
Again, a note, we expect that the coming two teams will follow the things that we had just discussed about the rules for the objection. Okay.
Yes. I'll repeat the rules just before we start again.
Okay, our time is up. We will be starting with 3 minutes now. Anusha,
All right, so
take over,
before we
please.
start, to both the teams, a little bit of a refresher on the rules. So you can only object thrice in the first round, that is a 3-minute round. And if two of your objections are overruled, you cannot object for a third time. So please keep that in mind as well while objecting. And during the 1-minute period, there are no objections allowed. And another thing that I'd like to add is when we reach the last phase of the 5 to 6 minutes, each team can speak for not more than 30 seconds at one time. So if you can speak for, of course, less than 30 seconds, you can speak for 20 seconds and then the other team can take over, but you cannot continuously speak for more than 30 seconds at a time during the back and forth round. So we hope you keep these things in mind. And with that, I'd like to wish you all the best for this round. Is the plaintiff ready?
Usha, 1 second. I think she's there, but then Tanya has some problem. Let me just check.
Sure. Team plaintiff, can someone else start? We'll give you another 15-20 seconds so that it doesn't delay the entire debate.
Yeah. If Tanya doesn't, I'll take over. Just like she's already there, but it's buffering. Yeah, if she doesn't, I'll take over.
Sure.
Tanya? Yes, hello. Sorry, is there a problem? Has somebody started? Am I audible? Can I?
Yeah, Tanya, you could just increase the audio a bit. You are audible.
One second. Can you all please wait just a second? I'm connecting my earphones once. Yeah. Am I?
Yes, we can hear you, but it's very faint.
Guys, am I audible now?
Yes, you're audible.
The RCs can let me know if I am audible or not.
Yeah, Tanya, you are audible. Go on.
If I am audible, can somebody please type in the chat box? I'm so sorry, I apologize.
Can you hear us, Tanya?
Yes, I can. Can you hear me?
Yeah, we can hear you. We can hear you. Don't worry. Are you
Right,
ready to go?
So I'll start it. And start the timer. Okay.
Okay, your time starts now.
Okay, good afternoon, judges and everybody who's listening. So in this case, we are the plaintiffs. There are some clarifications that we would start with, after which the case will flow. And we expect a better conduction this time. So very simple. So the first thing is that she was stabbed and she was stabbed and she refused to have an urine test. She did not to treatment. Therefore, the treatment could have been conducted. But the problem is that the doctor, who's the defendant in this case, did not ask the patient whether she wanted the treatment or not. He just asked her for the urine test, which was also at some point maybe necessary, but that was not the need of the hour. The need of the hour, the immediate thing that the doctor should have done was to ask her whether she wanted treatment, which is sewing her up, which is surgery, and not the urine test, which is probably something according to the law. But according to bioethics, we believe that first of all, the doctor has to do whatever the doctor has to do whatever he can do to protect the patient. That's number one. Number two, in this case, it was assumed by the doctor that the patient has no problem in getting anesthetized because she did not resist, which is a problem because just because somebody is not resisting does not mean that they want it. She already said, no, I do not want to get the urine test done, and therefore, even despite her saying no, when the doctor says that no, you have to. When the
Sorry
doctor
to
literally
interrupt, but
gets
an
her under
objection has
anesthesia
been
and
raised, I believe.
without letting
Tanya, can you hear us?
believe it is unfair, and we believe that the
Yeah,
doctor should.
Tanya, could you stop?
Keegan,
Please,
Anusha, can
Tanya.
you intervene?
Because she is an adult, and being she's
So
an
go ahead,
adult,
Tanya.
nobody asked her whether they can go to
I
the
don't
police or
see an
not, whether
objection.
they can
Tanya can't hear
Can you
us.
her
hear us?
parents or not, and they
Objection,
definitely just
please.
go back to the parents and inform the national
Talking
officers and
really
everybody
fast.
about it, which is also unfair because she is a woman.
Yeah, do you want to stop? Thank you.
Thank you. Back to Katyani. You can state your objection.
There's an objection in the leading. She is not really understanding. The doctor would take into consideration the mental state of a patient coming right into their OPD. And he needs to take into consideration whether the patient needs to go for a urine sample if she is inflicted by any sort of drug possibility or not. To refer to that statement, particular statement, objection leading.
All right. So moving to the jury. Hera Fery and Ninja, what do you have to say?
Objection sustained.
Objection overruled.
All right. So
With
we will
that,
move
we have to go to the judges. Judges, what do you have to say? It's the objection. I think Shimpa ma'am has lost network, so we will take only Sonali ma'am's ruling. According to Sonali ma'am, the objection is sustained, so we will give the time to team Antivaxers. Your time starts now.
You need to understand, to develop this case, you need to take into consideration the social structure. It clearly states that many people fall under it. people who are obliged to serve to the society, a doctor, a Catholic priest who does not break his seal of confession. And that the doctor took into consideration that the patient may be under the influence of drugs and hence could have inflicted the stab wound upon herself.
Objection.
She wasn't really in the best of her mental state.
Objection hearsay.
Action.
Go ahead.
Objection hearsay. The doctor only found out about the amphetamines after testing the urine. He did not suspect that earlier. He tested. Took the urine sample because he assumed that the stab wound was to the kidney, not because he assumed that she was under influence.
Absolutely.
Excuse me, just to add to it, a drug
Sorry,
test. Yeah.
you cannot do
I'm
it.
on the
It
same
goes
team,
straight to
right?
the jury.
Yeah, okay.
Okay, we'll move that on to the jury. Team No Hera Fery, please give me your ruling.
I think the objection should be sustained.
Okay.
Objection sustained from Ninja.
Objection has been sustained. So, Team Justice League, you have 1 minute 3 seconds. Go ahead.
So according to this, consent was not implied in this case because she verbally said no, and still the doctor has taken the urine sample. In addition to this, the doctor has informed the patient of a major woman. She is not a minor. He had no reason to inform the parents of the amphetamine consumption.
Objection.
All right, go ahead.
Yeah, so this is actually leading, speculation in a way, because see, there's a very high chance that, and there is also established evidence that amphetamine abusers have a high potential of harming themselves and others. So the doctor obviously had legal and moral obligation to inform both the law enforcement authorities and the relevant figures of authority, which is in this case the parents of the patient. And also, drug test doesn't, you don't simply conduct a urine test to find out everything in the urine. That's a very specific procedure. So the doctor must have exercised his I can't object an objection. Yeah. So the doctor must have exercised the best of his clinical acumen to come to a conclusion that the patient might be under influence. That is my
All right, thank you. Now moving it to the jury. No Hera Fery and Ninja.
Objection overruled.
Objection overruled too.
Great. So that
means we get an extra minute. We will continue the timer.
Justice League, you have 40 seconds. Continue.
According to Article 21, consent must be taken from all patients because they have the right to their own body, and this is a major woman. So since she has already said no, the doctor had no right in this regard. Also, the doctor has not immediately treated for the stab wound. He's gone into suspecting and testing her urine, which was not the need of PR at the moment. So in this regard, we would like to sue the.
Yeah, so the doctor definitely treated, right? Yeah, so finally decided a procedure to perform in which he would anesthetize her in order to sew up the wound to stop the bleeding. He also did that. So yeah, that is a very clear factual inaccuracy in your statement.
Okay, participants, let me just remind you how you raise an objection. You have to say the statement that you are objecting to first. Okay?
I'm objecting to the fact.
First. Yes.
Yeah, I'm objecting to the statement which the plaintiff made, which is in this case that the doctor didn't, sew up the wound, which is the need of the hour, and the fact of the case suggests otherwise. Yeah.
Thank you. So, just a reminder: statement. On what grounds? Explanation. Okay, that's how you will go with your objection, and that's what the judges will be marking you on. So be very, very careful with how you're raising the objection. Now that we've gotten this objection, we'll hand over to the jury. Jury, sustained or overruled?
I think the objection should be overruled from No Hera Fery.
Objection overruled.
Okay, so that's another objection overruled. That gives Team Justice League 1 more minute and also 13 seconds.
And
Team
in
Justice
addition
League.
to that, anti-vaxxers cannot raise any further objections after this. So over to you, Justice League.
So according to the laws in the Indian laws, they cannot inform the parents unless the patient has given written consent for this matter. This was overruled by the jury.
Okay, you have 2 more minutes. So You can continue.
I would like to give the mic to Sajal.
Yeah, so if the opposition knows what the meaning of CFR is, that clearly means Code of Federal Regulations. According to section 42 CFR part 2, it states that the substance abuse treatment programs are not permitted to disclose any patient information that would directly or indirectly identify a patient having previous or current alcohol or drug problems. However, please emphasize on the point, however, there are very limited exceptions to the requirement of written consent, which are, first of all, medical emergencies, qualified scientific research, audit or program evaluation, and court-ordered criminal. In this case, it was a medical emergency. If you are a doctor, of course you will be a doctor. So I don't think so. If a person is lying with a 3-inch, 3 centimeter stab in his or her body, I don't think so. You would go for such consent. And moreover, if you say so, if you go with consent, it is clearly stated that 42 CFR Part 2, it's a medical emergency and it can be carried out without consent. So I guess that's from my side.
Okay. Yeah, I'll take over. As as the defendant mentioned, in this case, although the doctor took an effort to treat the patient, but in the disguise of treating the patient, urine was collected, which is totally wrong, because according to the informed consent rules applicable in India, no physical examination can be carried out before. No physical examination apart from the normal regular physical examination can be carried out without the consent of women. So the point here, informed consent, even if it is expressed, as Sajal also mentioned in CFR, is totally applicable, and there is no need for written consent. So if she refused, the refusal should have been respected, and no urine test should have been conducted until the patient becomes totally fine.
All right. Thank you so much, Justice League. Now we will go to the 3 minutes for anti-vaxxers.
How many objections does Team Justice League have left?
All left. They didn't object. They were presenting. So they can object to 3 at the most, and 2 if that is if you get overruled. So are you ready?
Yes.
Anti-vaxxers. Starts now.
There's clearly a very factual inaccuracy in the case that was presented proposition. What we need to understand is that a doctor in his best clinical understanding does understand what a patient under some influence of drug may be. It was an incidental drug test that the doctor thought was necessary at that time according to his clinical acumen. You cannot question the clinical acumen of a clinician. A person who says or I do not resuscitate policy is in the best or the fittest of his or her
Objection.
medical condition. The very famous.
Objection relevance. Objection relevance. We are not talking about DNRs. We're talking about this case. This has nothing to do with the do not resuscitate.
If you give me the privilege of completing my sentence, I'll tell you where it comes from.
I raise objection before that.
You need to
So this goes to the jury.
Time is running out if the team can look into it.
Kian, can you pause the time?
Sorry.
Yeah. Now going to the jury.
Objection is sustained.
Objection is sustained too.
All right. So accordingly, we move on.
Okay, there were 2 minutes because I had not paused it for 10 seconds. So we give it to Team Justice League. You have 2 minutes. The time starts now.
Yeah, so according to what the defendant stated, the judgment cannot be questioned. So I would like to remind the defendant, doctor's judgment is not absolute, and consent, if refused, should be taken into account. If not, if the doctor still feels that the patient was under the influence of any drug, which is hereby not mentioned anywhere in the starting, he could have consulted a panel of other doctors. Here, he has considered that his clinical acumen is completely right, and he has every right to do a urine test when it was not even essential to do it. So instead of focusing on the treatment, what could have been done for the patient, he is unnecessarily focusing upon diagnosing that the patient is on some drug overdose or something like that, which is against the very essence of Article 21 of the Constitution, and also against Article 87 of the IPC, which clearly states that informed consent is necessary, and since the patient is major, her consent should have been considered relevant and should not have been ignored the way the doctor did. And according, and second, and moreover, if the patient, if the doctor still feels that he could have done the, the second problem with what the judge,
If we can make any more objections, we'd like to highlight the fact that it's Article 21.
I'm sorry, you can't raise any more objections because you objected twice and you were overruled. So continue, Justice League.
Okay, yeah, thank you so much. Secondly, the doctor did another mistake. He was under the obligation to inform the police and the public health authorities, but under the pretext of confidentiality, which is also an essential part of autonomy, he should not have informed the parents, because this is not something that could have affected the parents indirectly or directly. So the doctor did a willful mistake in informing the parents apart from the public health authorities. Thank you. I rest my case.
Thank you.
Justice League, now we go to the next round where Justice League gets to speak for 1 minute, and that's uninterrupted. So whenever you're ready, Justice League. Justice League, are you ready to go?
Yes, Sajal will go from our side.
Yeah, first of all, as Arpit stated that I would like to emphasize my point on the CFR section. It was not a legal, it was a legal obligation. I must agree with that, but under the legal applications of that, it was a medical emergency. The doctor shouldn't, and the doctor did a medical operation. He did find the drugs and all of that. He breached confidentiality, the pact of confidentiality in that process. He shouldn't have gone. He shouldn't have told the parents. He shouldn't have got the other relatives involved in all of that, because it was a breach of confidentiality.
Excuse me, the timer isn't running.
Sorry.
I guess he ran out of time anyways.
Okay.
So should I go again? Should I go again, or?
Yeah, you will go again. Go from the start. 1, 2, 3, go.
So first of all, I would like to re-emphasize on the point of the CFR 42 section. You could have done. You could have the person doctor shouldn't have gone to the shouldn't have breached the confidentiality pact, and moreover, it was a breach of 42 section CFR. It clearly states that under legal applications and drug abuse and all of that stuff, you have to carry out a legal procedure, and you can be exempted, and you are only exempted. Emphasis on the word only, because under the legal obligations of medical emergencies. So it was a medical emergency, and it clearly states that the person shouldn't have, the doctor should have gone with the operation. If he found the drugs, that was a breach of confidentiality with the patient as well, because the patient didn't want that his family should be involved. If at all they wanted, and the patient could have gone and
done. The time is done. Thank you, delegate. Thank you. We will go on to the next team.
Yeah. So to begin with my case, initially we are ignoring the entire premise that the patient might have been in an excited state of delirium before, in fact, presenting to the hospital itself. So once you take that into account, she actually in a way a risk to the society, and there's also no explanation whatsoever to the wound that is on her back. So there is a very high chance, and there is established evidence that says that people on methamphetamines have a propensity to either harm themselves or others. So in this particular case, the doctor was obliged, you can't object in this, the doctor was obliged to report to relevant law enforcement authorities and make sure that the societal framework is maintained. And also, once you take into consideration the fact that the doctor had to specifically order a test that, tests for methamphetamine, it is pretty evident that the doctor just needed confirmation, and it was clear as day that the patient was under influence of a drug which is illegal as per NDPS Act 1971 in India.
Done. Your time is done. Thank you. With that, we will move on to our next round. For 5 minutes, we will have a rebuttal. Anusha.
Yeah.
Wait.
So,
Yeah.
yes, so your time starts now, whichever team goes first.
So Justice League would like to go. First of all, I would like to emphasize on the fact that the defendant is completely focusing their attention on the fact that amphetamines was discovered in the urine of the patient, and that was done after the patient was taken into OT. Nowhere in the case it is mentioned that the patient was under the influence of drugs whatsoever before the patient came into the OT table. So that argument stands neglected.
Right.
Secondly,
30 seconds, 30 seconds.
Yeah.
We swap here,
Yeah.
30 seconds. Anti-vaxxers?
Yeah, so I would like to put on my views too. So I feel that this issue of reporting the amphetamine use is a kind of a situation where beneficence is arising. So I feel that here, as the opponents were again and again repeatedly stating that it's a wrongdoing to tell the parents. So I feel that beneficence mainly acts on addressing the good for the third party too. So by addressing the parents, they have actually done a good thing indirectly. Because if a patient is on amphetamine usage, it would be a toxicity in the long run.
Okay, 30 seconds, Justice League.
So when you're talking about beneficence, how will it be beneficent to them if they inform their parents? What if the parents are someone who's going to beat them or something? You don't know the history of the patient. You don't know where she's from, what background she is in. You can't assume that the parents will do the best for their child. First of all, she's an adult. She does not need her parents to know about what her lifestyle is. And her husband has stabbed her. Should that not be your priority? You should be informing her parents about her husband, about domestic abuse. Why go for drugs first?
All right, we swap again.
We'd like to highlight one very important fact in the argument, starting my 30 seconds now, is that you cannot directly come to conclusions. When you're a doctor, you need to be impartial to the conclusions on whatever the basis they are arising on. Hence, you also need to take into consideration that the stab may be self-inflicted, that she may be under the influence of drugs. You assume every patient is pregnant until otherwise proven. Hence, you take into consideration that everybody who is under a mentally distressed state, is under a state of PTSD or post-traumatic stress disorder, should be in a condition that's not really viable. Incidental findings should be taken into consideration.
Okay, if I'm audible, first of all, that does not make any sense. We never mentioned any pregnant lady, and we did not at all blame anybody and said
Understand the meaning of metaphors.
Our point is okay. Whoever spoke, please, guys. So see, it's a very simple. The case is very simple. A woman who is above 18 and was living with a partner has been stabbed, and our problem is that her consent was breached when she said no to the treatment. She was even then treated, and that is our problem. We do not talk about amphetamines because the doctor found amphetamines by mistake. It just happened. Nobody was looking for amphetamines in the first place. That is why it is not important in this case.
You need to realize that no one can find out amphetamines by chance. The doctor had a good reason to suspect that the patient was under the influence of drugs, and no one should actually trust the judgment of someone influence of drugs. Right?
Student doesn't smell of amphetamines. Just so you know.
I would request you to read the statement first. The doctor, the doctor had a reason to suspect that the patient was under
the doctor was looking for amphetamines. The doctor was even looking in the urine test. The doctor was.
I'm sorry. They'll get extra time if you interrupt. Anti-vaxxers, please go on.
Yeah, also for the other point that the opponent made, that it's not a case of beneficence by telling the parents. Well, it's so negligent if we take that the parents would slap and beat her in the short, period of time. In the long run, we see amphetamine toxicity can produce a lot of harm in the patient. So compared to the adverse effects in the long run, this is very negligent and very meager point to make.
The stab wound has more of an effect than amphetamine use. That's more.
That was treated, right? That was sued up, right?
Because under your paradigm, we're supposed to trust the judgment of a person who indulges in drugs.
In amphetamines and stimulants like amphetamines, which are known to have a propensity to induce harm-causing
But still,
tendencies.
she had not given any consent for him to test
You
her
don't
urine.
need
How
consent
Please
when it
note
comes to checking
anti-vaxxers
out
are
something
interrupting.
illegal.
I do not think and I do not condone the crosstalk. Okay, there are 5 seconds left. Please do not crosstalk. Anusha, whose turn? Anusha?
It was anti.
Go ahead.
Justice League, go ahead. You have 5 seconds.
Yeah, I have the last point to mention. If the doctor felt that the patient was under the influence of drug, why on the first time was consent taken?
Okay, with that we will end. With that we will end. Thank you, both teams. We will be giving you the results of the second round very, very soon. I'm sure the judges have a lot to contemplate upon and a lot of tough decisions to make. So while they do
But
that,
see, I would like to add something onto this. See, like
wait. We're not adding anything to anywhere.
No, we're not talking. I'm not talking about the case at all. I'm talking about the format, right? See, speculation is entirely different from metaphors. As long as people see, like this was the most, it could have gone off on a tangent very easily. But
Sai, may I say something? I think you should trust your judges to be able to understand the metaphor and therefore to be able to evaluate how people have interpreted your statements too. Yeah. If you'll keep on cross-talking like this, it's going to be very difficult to have a nice, fair final round. So I would go with the moderators and request from their side also to cross-talk. Okay. This is an expression of what we know and a discussion forum. This is not a fight to death, Yeah, let's enjoy it. You all are doing such a wonderful job. I mean, genuinely, I'm enjoying your discussions, and I'm overawed with the knowledge you children have. I was really not expecting even this standard, and you all have surpassed what I was expecting. So well done. Let's keep that tenor the same way, so that we can end it also with this kind of grace. Yeah. Thank you.
Thank you, ma'am. Thank you for that. And all of the participants, please remember that, like we mentioned yesterday, this format is very new and it's something that we've not tried before. So if you have a problem with it, we did ask you yesterday, but even if you did discover that you had one today, we will be open to feedback. Please text Anusha or text me. I'm sure we're very, very open to constructive criticism. And we will make the required changes in the final round or probably the next time we're doing this debate. Thank you for your time and thank you for the wonderful discussion that we've had. We really appreciate each one of you preparing so much for all of the things that you all put forth today. It was very, very well thought. It was very, very well planned. It was very, very well rehearsed. So give yourself a pat on your back. Whatever the results may be, you all did an amazingly good job. Thank you. Anusha, do we have photo elocution results now? Will we wait for the final results?
I have Dr. Princey ma'am with us. Dr. Princey ma'am, can you hear me? Yes.
Do we have Dr. Mrinal ma'am also along with us?
I am there.
Yeah, good. We also have Dr. Mrinal ma'am. Dr. Princey ma'am and Dr. Mrinal ma'am were the judges for the photo elocution competition. Anusha, please take.
Yes, sure. Mrinal ma'am, would you like to disclose the third prize? Shana,
So
yeah.
first of all, I would like to congratulate all the participants. Okay, all of them extremely well, covering all the aspects of bioethics. So for me, everyone are the winners, but still, it's my duty to disclose the first, second, and third prize. The third prize goes to Alicia Joykutti.
So this was the photograph sent by Alicia Joykutti. Shayan, I suppose we won't be able to play the video while live streaming.
Yeah, we won't be able to play the video, so we can move on to the second prize.
All right. The second prize goes to Janvi Gupta, who had very wonderfully covered the aspect of all the ethical issues involved in child labor.
We will be sharing the videos with all of our participants as well as putting it up on our Facebook page. So don't worry, you'll get to watch it. It's just right now because we are live streaming, we won't be able to play the video alone. Now coming to the first prize, Dr. Princey ma'am, would you like to disclose the first prize?
Yeah. Dr. Mrana, tough time judging this photo elocution where they had a photograph to be taken from a live, not from internet or any other, and they had to speak for 5 minutes over it. So you have seen the wonderful pictures. There are other wonderful pictures, but the final prize we had judged them on originality, sensitivity, and overall presentation. So in the overall presentation, they have used and understood the human rights and the fact of dignity and how dignity violations were occurring and how dignity should be upheld. In fact, so as you have seen, the first prize goes to Aryan Karbanda from Delhi. The second prize was to Miss Chandi Gupta, and the third prize went to Alicia, right? So that was the judging, but you can all see all of those, all of these entries. You may be visualizing it. You can see it on the Facebook page of Caduceus, right? So I think it will be really helpful, and the way they have talked. In fact, one of them was about, about small children being painted up, waiting for the foreigner and the tourists to come and take their picture. So all these kind of new areas, child labor, looking into children off the street, looking into water, the scarcity of water. So that is the reason why this finalized this final 3 entries have clicked and got the prize. But it's not just the prize winners, all of them were good and with all of these entries, and it was really nice to have a different point of view. I like the aspect of domestic violence. The person put her own face, a lady, domestic violence. So that was also a nice way of putting it, and talked about domestic violence. So these are all wonderful entries and wonderful thoughts and angles, a different viewpoint. That is why this kind of session of photo elocution. In fact, there has never been a photo elocution. There have been photo essays, a photograph that clicks, National Geographic gives the best photography prize, right? So like that, this one, an eloquent photo in itself, but also added up by words, how the dignity violation has occurred and how it can be corrected, and what are the rights that are in place for this not to happen. So here we have learning and we have understanding and a development of moral sensitivity to identify the moral problem here, and then you should have the moral character builds up, and that gives you the moral courage to stand up and take a moral stance. So all this develops your moral compass. So that was the objective, and I think we have realized this objective in this competition, and it will go really further in inculcating this kind of facts in all of us, right? Next time you see something happening, you would know this is a good picture for others, and it will bring a lot of understanding. Thank you.
We are extremely grateful to both of you, Dr. Mrinal ma'am and Dr. Princey ma'am, for taking so much time out to judge all these participants early in the morning today, in fact, on a Sunday morning. We're extremely grateful, like I said, and we're looking forward to having you on again for competitions that we organize. And at the
We
same
had a
time,
wonderful Sunday.
thank you, ma'am.
You made
And
our
we'd
Sunday
also
great.
Thank you, ma'am. Thank you for being part. We, of course, invite you to stay on for the rest of the debate. Our final round will be starting in the next 5 or 10 minutes. So we invite you to indulge in that as well. And in addition to that, we'd like to thank our participants who are here from the photo elocution segment. It was very inspiring to see the message that you had to share with us. And we learned watching those videos, I think myself and the rest of the organizing committee learned so much as well. So we thank you for this kind of encouragement and support that you give to us when we organize events. It pushes us to do so much more. That being said, if our judges are ready with the results, we'd like to move on to the final round. We just give our judges a few more minutes to tally the scores.
By that time, Anusha, you can just brief about the final round. Otherwise, even after the result, you can brief them again.
Sure, ma'am.
What about the final round will be? Yeah.
Like we mentioned earlier, we'll be following the format that we followed in round 2. So that is the first team gets to speak for 3 minutes. And again, you get a maximum of 3 objections. If at all 2 of your objections are overruled, you cannot object for the third time. And then the next team goes for 3 minutes and the same procedure is followed. Then when we come to the 1 minute rounds, you cannot object to anybody. Also, we had a lot of queries about double objections. It will not be permitted. So we request you to refrain from asking for them as well, because that could result in you losing a couple of points. And when we come to the final segment of the back and forth, again, we request you to respect the other, your opponent's time. And we request you not to raise your voice and maintain the decorum of the debate as well, because all of these things are factored into the judge's decision at the end of the day. So that being said, we wish you luck for the final round, and we're very excited to host you again. Keegan, anything to add?
The results are ready. So the only thing that I would add is all the best, to all the participants, all of you who do not make it to the final round. You all did a great job. It was really, really entertaining and informative listening to each and every one of you. And I won't waste any of your time. I will hand over to the judges. We have handed them the scores. So, ma'am, if you could just read the scores, and then we could reveal the 2 teams that are in the finals.
Dr. Sonali, could you do the honors, please?
Okay. Okay. Do the organizers want me to read the scores for all the 4 teams, right?
Yes, ma'am.
Okay, fine. Fine. So, the team Ninja has got 176 as a score, then followed by Antivaxers getting 182 score. After that, No Hera Fery has got 195, and finally, the top one is Justice League with 203 as a score. Congratulations to all the teams for this. All the 4 teams are actually the winners. Okay, and this particular the activity is actually a learning experience for all of us. So it's a part of the formality that we need to choose 2 teams for the final round. Otherwise, each and every student who has contributed with so much of enthusiasm is a winner in our eyes. Truly.
So congratulations to No Hera Fery and Justice League for making it to the final round. And I'd also like to tell the other teams that we still have other prizes like the best presentation and the best speaker and the runner-up speaker. So don't lose heart. You might just end up with one of those prizes. So do stay along and enjoy the last segment. That being said, should we present the screen for the last, the final round? Shayan, are you there?
Dan said he was away for 5 minutes, so we'll end. Okay, are you all ready for your final case, teams?
Can we get an affirmation from No Hera Fery and Justice League?
Yes, we're ready. Team Hera Fery is ready.
Justice League is ready.
Enthusiasm. Anusha, can you see my screen?
Yes, perfect. Okay. So X is a 32-year-old woman. In 1990, a man with whom she had a long relationship informed her that he was HIV positive. She then was tested for HIV and the result was positive. After having discovered that she was HIV positive, X embarked upon a regime involving alternative medicine, therapy, a strict diet, and healthy living. From her point of view, after 8 or 9 years, this regime had left her very fit and well, although she remains HIV positive. Now, in 1997, she met a man whom she had not married. He was tested for HIV and found negative. They then tried to conceive a child. Their daughter was born on the 8th of April in 1999. They chose not to go through the normal challenges of registering at a hospital for pre and postnatal care because they were concerned that the conventional medical treatment would force them to adopt what they both considered to be an unacceptable approach to birth. The mother gave birth to her baby at home with the assistance of a midwife. You can take a picture if you haven't yet taken a picture of the case. And we will move on to the next slide. She had a natural birth and the child was born entirely fit and healthy. Because there was a 25 to 30% chance that this child would be born HIV positive, doctors felt that the child should be tested. If the child was HIV positive, further treatment would be highly desirable. Despite the request of the medical staff, the parents refused to have the child tested for HIV. The doctors then got the child tested and found a HIV positive. So now X files a case against the doctors. So in this case, of course, X is the plaintiff, the defendant is the doctor. We will have the coin toss in this segment
I have
again.
a doubt regarding the case.
Yes.
So the last line states the doctors got the child tested. Does it mean against the will of the parents?
Yes,
like
against
how,
the
like
will
did
of
they
the
abduct the child? So how did they get? It's like a small child.
Basically, the parents did end up going to the hospital and they did not for a normal checkup and they did not want the child to get tested. But during the procedure, the doctors quickly did test the child against the will of the parents, and the parents were unaware of this, and they
No,
did
no.
find that the child
my question is,
Yes.
I was asking that when it says that the doctors got the child tested, was the testing done for any other procedure? Was incidental finding the HIV, or the doctors? So how did they get it tested when the parents were refusing? So how can you like get the blood from a child whose parents are refusing?
That is the question. That is the case that you all will have to decide right now.
No, but my first question is it incidental finding on like some other procedure they were doing? They did HIV testing.
Okay, so if a mother is HIV positive and the doctors would obviously suspect the HIV positivity of the case, leaving that aside, leaving aside whether it was an incidental finding or whether it was a finding that was taken after deliberation, uh, leave that aside and fight the case without that information. I'm sure you can.
Okay. Okay, can you just send the photo of the like the group as well? I didn't take it, I think.
Can you
The
display the
second
slide
page, we
again?
missed it. Second page of the screen.
Okay, we'll send you a picture of it. Anusha, can you please send a picture of it?
I have already shared the content in group, Keegan.
Okay, great. Thank you, Shubham.
Yeah.
We will
Can
be
one of the teams call heads or tails?
I'll call from team No Hera Fery, we go for heads.
okay. No, Hera Fery goes for heads. That means Team Justice League is tails. I am tossing on the count of three. 3, 2, 1. Great, heads wins. So I believe No Hera Fery went for heads. What do you all choose to be, the plaintiff or the defendant?
Just a second. I think we'll be the doctor.
That is the defendant,
Go for
right?
it.
Great.
So we
Okay,
will
then
give you
if No Hera Fery is the doctor, then that leaves Justice League to be the plaintiff. That is Miss X. I will share my screen again with the timer. 1 minute. You all see my screen? Not anymore. You all see my screen?
still sharing. Yes, yes, we can see it.
Okay. Plaintiff, that is Justice League, you have 3 minutes. Your time starts now.
Okay, we get 5 minutes to decide to
Sorry.
discuss.
Yes. Sorry. My bad. Time starts now for the 5 minutes.
In the meantime, if our judges would like anything to say, any of their feedback, comments, any additions for our participants?
One thing I would like to add over here that whatever the scenarios have been taken for the debate, they are well chosen, and there was a lot of scope over here because of these scenarios to talk about the different aspects related to. I think these scenarios have covered all the 4 principles of bioethics. So we can talk about the autonomy, we can talk about the benefit as well as harm, which is the theme for this year's World Bioethics Day, and as well as about the justice also. We have explored the various aspects about it. So the case scenarios are really well chosen. There's always there might be some doubts or queries in any case study, but yes, they are very comprehensive and very interesting and very relevant to the healthcare practice.
Thank you, ma'am. That was all our
Yeah.
team. That was Anusha, Jalak, Dhwani, Rahul.
Yeah.
Great.
And Shubham.
Yeah,
And
and
Shubham, yes.
and this type of case discussion, it is such a useful activity, particularly to explain the bioethics, right? Because there is so much of hidden things that we need to dig it out after discussion. This cannot be like delivered through a lecture, or we cannot have as such a practical. For that, a case-based discussion is a very right platform for exploring the domains of bioethics. I think so. And I always like to compile these case scenarios whenever I come across. And you,
the first two from the
pardon?
We could share these cases with you if you like to
Yeah,
have
yeah. I was taking the screenshot whenever you were focusing it. And there is also the case books with regard to the benefit and harm, and given by the UNESCO, as well as the curriculum is there for that, which mentions a lot of, which gives a lot of examples in routine practice that we come across. So this is a real, it's a good modality to learn these things.
Yes, ma'am. Actually, our first two cases are taken from the UNESCO Handbook of Bioethics.
Right.
I noticed. Can I make a suggestion here? You all have got fantastic cases put together, or you all have sourced them. You've heard how the discussions have gone. If you all could identify the trigger points in those cases, right? And if you could put the question next to the trigger point, it would allow any student reading the case to actually look at that trigger point and explore that point.
Yes,
sometimes when you are new to the field of ethics, you don't know everything that could be an ethical issue. Like, for example, somebody just said that, people who are mentally anxious, in the first case scenario, they said those who are depressed and mentally anxious do not have sex, right? That's a trigger point for a big discussion. Similarly, here in this case, somebody said those who are mentally anxious could be under influence or something like that, So these are actual misconceptions about mental health. Everybody who's mentally anxious is not abnormal. They may go through all the normal motions, so they don't have to be abstaining from sex or be drug dependent, So you could create trigger points in your cases for your students and for your colleagues. I don't know if you all have the time with all your studies and everything, but that would be a wonderful thing to create. Each of you takes one case, just identify the trigger points and just put the trigger point down. You don't have to explain it. I mean, that would be a wonderful outcome of this entire discussion. I might like to have a copy of those trigger points in the cases if you ever get down to doing it.
Yes, ma'am. We'll sure send it your way if we do it.
And I'm wondering why that doctor didn't do a urine for pregnancy but did a urine for amphetamine. I mean, when someone said everybody is pregnant unless proved otherwise, I mean, I wish he had done a UPT rather than a urine amphetamine. Anyway.
Okay, participants, your time is up. Your time is up. Plaintiff, you have 3 minutes. Tell me when you are ready and we will start the timer. Justice League? Justice League?
Can someone from Team Justice League respond? Arpit?
Anush. Yeah, Kansha would be. Yeah.
ठीक है.
Akansha, could you go on?
Am I audible?
Yeah.
Okay, so first of all,
our case is that the child that was tested, that wasn't tested with our consent. So we are strongly against that, because according to the health ministry, the HIV Prevention and Control Act 2017, released by the health ministry, it clearly states that no person shall disclose or should be compelled to disclose the HIV status or HIV related information except with the informed consent for undertaking those HIV tests. So I fail to understand that how could someone without their consent undergo such an HIV test? Like, it's our choice, the way we wish to raise our child, and the mother, she is clearly, obviously, as the parents, they clearly care for the child. So obviously, like, they were going to undergo somehow treatment at some point, but I don't see that it's just on the part of the doctors to undergo such kind of testing without taking the parents' informed consent. So I think that's definitely what should definitely that should be taken into consideration as a
Objection.
doctor.
On what ground? What statement?
It's a hearsay when the plaintiff mentioned that the parents will be obviously going for treatment. It's not mentioned in the case.
Okay. Okay. We will take that up with the jury. Jury, what do you have to rule on that?
Keegan, how about we go to the judges for the jury for this round, since it's the final round?
That would be better.
Judge,
Dr.
what do you have to say that? Yeah, I think that objection is sustained. That means team No Hera Fery gets 1 minute 39 seconds. Your time starts now.
Just a second. Is Prachi, are you going, or I shall go?
Okay, for this time.
Oh, okay. I'll go. Right. Please start the time. So even if the plaintiff claims that there has been a breach of confidentiality, let's understand a very important MCI ethics regulation of 2002. The section 2.2 says patience, delicacy, and secrecy. Patience and delicacies should characterize the physician. Confidences concerning individual or domestic life entrusted by the patient to the physician and defects in the deposition or character of a patient observed during medical attendance should never be released, wait, unless their revelation is required by the laws of the state. Sometimes, however, a physician must determine whether his duty to the society requires him to employ knowledge obtained through confidence as a physician. In the case it's mentioned, there is a 25 to a 30% chance. Understand that this is a very big number. It's a 1 by 3 chance. Secondly, understand that the parents delivered the child at their home because they did not like the conventional medical treatment. In this case,
Objection.
the defendant
Objection.
believes.
What grounds? On what grounds?
Hearsay, he said the parents delivered at home because they did not believe in conventional treatments. It's not mentioned in the case that they delivered because of that reason.
Okay.
Literally just mentioned. I just read
It's
it from
not.
here.
Okay, we go to the judges. What do the judges have to say? Okay, just to clear that out, it is not in verbatim that they did not believe in conventional medical treatment. What is said over here is they chose not to go through the normal channels of registering at hospitals for pre and postnatal care because they were concerned that conventional medical treatment would force them to adopt what they both considered an unacceptable approach to the birth. So that is the uh, verbatim that is used in the case. With that, we have a verdict by the jury. It's overruled. Okay, great. This objection is overruled.
Right. So coming to understanding what the harms and benefit in this case is. The harm that the plaintiff claims is that there has been a mental effect on the parents, right? But understand that a child who suffers from HIV will literally go into mental retardation, will not be able to.
One minute. One minute.
Hearsay.
Okay.
We didn't mention anything about the mental status of the parents.
Over to the jury.
Can someone just recap what he said? Because I'm a little confused about this objection.
He said that the parents, we said that the parents will have mental repercussions about this, but we never mentioned anything about mental repercussions.
I said plaintiff can claim.
But that's hearsay. That's why I raised the objection. We didn't claim it yet.
Okay, that objection is sustained. Team Justice League, you have 29 seconds. Your time starts now.
As the case clearly shows that the parents had given birth at home and the child was fit at home, how does that give the doctor any right to test a child that has not been brought into the hospital? The doctor is breaching his own...
Objection.
What point?
Relevance. Relevancy. They said that the baby was delivered at home, so the doctor has no right to test the child for HIV.
Okay, and your objection is with relevance.
Yeah,
The ground of relevance,
because HIV being a notifiable disease, the doctor has the grounds to notify, test
the verdict is
HIV in
out.
high-risk population.
That objection is sustained. Moving on to team
Great,
No Hera
Prachi, you
Fery.
continue for the 13 seconds.
Okay, so the thing is, HIV, like I already mentioned, HIV being a notifiable disease, this gives all the right to the doctor to identify the patient harboring HIV in high-risk groups, and which is why the child being tested was not against confidentiality.
Thank you, Prachi. Thank you, No Hera Fery. Thank you, Justice League. With that, we come to the end of Justice League's turn. Now we go to the defendant's turn. That is No Hera Fery. You have 3 minutes. Your 3 minutes start now.
Okay, so first coming to the case, the defendant proves its claim by quoting the Indian Medical Council Professional Conduct Ethic Regulations 2002, which clearly states that a physician must determine whether his duty to society requires him to imply knowledge obtained through confidence as a physician to protect a healthy person against communicable disease. The child, it was in the correct faith and according to the law for the doctor to test the child for HIV, also considering the pillars of bioethics, which is non-maleficence and maleficence, which is to do good and to do no harm. The doctor obeyed both the pillars of bioethics, as the child having HIV would not only have a communicable disease, but also at the same time would have mental retardation and further stunted growth.
Objection. Objection. Relevancy is the child was born fit and healthy, as clearly mentioned. She's bringing in mental retardation unnecessarily.
It was talking in context to
We do
beneficial.
not have explanation. Objection. Please do not add to an objection. We will give it to the jury. The jury will decide, and then you can add if it's in your favor. Objection has been overruled. That means Team No Hera Fery, you have your time to go. Also, Team Justice League, you're out of objections, so I'm sorry, but you cannot raise any more objections. Team Hera Fery, you have 2 minutes, 10 seconds. Your time starts now.
Moving forward, as I was saying, in the child having HIV would have a risk for mental retardation and growth stuntation. So it was in the correct favor of the child and for anyone the child comes in contact with. Talking about privileged communication, which also has certain infectious diseases do play a major role, where it is necessary to inform the appropriate authorities. It was within the best interest of the patient and the society for the doctor to test the child and to inform the society in the future. Prachi was like to continue from here?
Yeah, Neil would like to continue from here.
Yeah. So I would like to add, saying that in this case, wherein the patients are not actually given a consent or a written statement stating that the doctor can be sued, like in near future, for not conducting the test, because the doctor can be sued in near future because there's no written statement by the patient for not going ahead with the test, because there can be so many malformations or say neoplasm or cancer, whatever it is, because it's a baby we are talking right here, and they can be sued for the same. The doctor can be sued in near future, so that is why the doctor went ahead doing this thing. So if anyone would like to add from my team,
I'll come to the additions. Yeah, Prati, you go on.
So continuing to what Neil said, the baby was actually born healthy because HIV symptoms don't appear in 1 or 2 days. It is something which takes several years to develop, and the doctor in his right faith had tested the child for HIV, which cannot be counted on against the argument here. So I would say that the doctor wasn't wrong. Akash can continue.
Right. So understand that a right of one person or two person in a case is subservient to the rights of the society. The child will grow up to be an HIV positive person, and there is 25 to 30% chance, that's 1 in 3, right? So, so the child can transmit the HIV infection later in life, and hence there is no case made from any liabilities.
Thank you so much, Akash. Your time is up. We now move to the next round of 1 minute, that is from Justice League. No objections in this round?
Yeah. So I would like to first. Yeah. So I would first like to state the very fact that the defendant focuses upon, which says that the doctor would like to go on and tell the public health authorities, which is nowhere mentioned, has been done till now. Secondly, they focus upon the aspect that written consent wasn't taken, where the patient denied going for a test. But even if the consent was not written, express consent could have been considered as here. Thirdly, the doctor can be sued only on the pretext when the patient himself wants to sue the doctor. It cannot be done by any random person, and it is very well documented in the legal rights which are available. The doctor can be only sued for professional negligence by the patient itself and not by any random person. So, fourthly, Article 21 and Section 87 IPC, where the parents have the role to decide what to do for the child and take decision in his favor, has been disregarded.
Okay, thank you. We have the defendants, that is Team No Hera Fery now.
Yeah.
Time starts now.
Great.
Okay.
So let's take the plaintiff's case in their best case, right? Okay. They tell us that what will happen if so no consent was taken. We tell you that there is a significant risk to the child's health as well as to the health of the community at large. And Article actually reads, no person should be deprived of right to life and liberty except as per procedures established by law. Understand that if the child will grow up, there is literally a lot of life that can be lost, not just like by that child, but like that child's death, but also to the community at large. And the plaintiff is lying by saying IPC section 87. IPC section 87 reads, act not intended or not known or likely to cause death or grievous hurt done by consent. I think their case is on lies. They are misquoting articles. They are not telling what damage we have done. I think in order to save the life of the child, it's right for the doctors to do the HIV test.
Thank you. Now moving on to No Hera Fery.
Wait.
We just
Your
spoke.
work, No Hera Fery. So we have 5 minutes of the rebuttal round now. I will pause. We will start with the plaintiff. Okay, you have 30 seconds. Your time starts now.
Okay, so see, so abhi like till now, whatever the debate has happened, there is a clear contrast between consent of the family and beneficence of the child and the society, right? So when these two things are clashing, we have to look at a cost benefit analysis and understand that when they are talking about beneficence, they are assuming that the parents, when they find out that the child is HIV positive, are not going to take any action, which is unfair. Obviously, if my child was sick, I would definitely take them somewhere. That is why it is an assumption that the parents will just sit at home and do nothing about it. That's number one. Number two, consent of the family is
Can we
more
answer?
important
I
here
think
because
30
you have
seconds
to.
are over.
Is there a rule about 30
Yeah,
seconds?
I'd like to add. I
30
think it
seconds are
is our
over.
turn. Yeah.
Yeah,
So
maybe
I'd
next
like
time.
to.
Maybe next time. Okay, so understand from the defendant sides, it's mentioned that the parents refused consent even after the doctors told them there is a significant risk. If this type of attitude of the parents continue, understand what will happen 25 years down the line. It's wrong for the plaintiff to assume that parents care for the child. The parents are not giving consent even after the doctors told there's a 25% chance for the child to he needs to be treated, and there is a 25% chance he will have HIV. I don't think the parents care that much.
30 seconds, next team.
Yes, so first of all, that is an assumption. What will happen 25 years later is literally none of my concern, none of your concern. Number two, that is exactly what consent means: the ability to say no. If the authorities have asked the patient, asked the parents that do you want to get this HIV test done or not, and the parents have said no, that is literally the definition of consent. It does not mean that the parents don't care. That is a huge assumption. Also, it's kind of misleading to the court when you say that the parents don't care. Does the hospital care more about the child, or does the hospital only care about the society? This hospital only cares about the society, and that is what our problem is. Our problem is that the child is young, and therefore the
Can we
parents
answer?
need to consent to it, and
Yes,
that is
30
overruled.
seconds. Hold on, Hera
Okay.
Fery. Okay, sorry, we'd like to
Does someone
answer.
else like to
The
go?
panel
Yeah,
can go
Prachi, go.
this time.
I'm going ahead. So I would just like to add one thing, that there is no sort of professional negligence here. And as Prachi notified many times that HIV is a notifiable disease, and if you go by the definition of a notifiable disease, you are supposed to mention about it. You are supposed to mention about it to the public authorities. And talking about what will happen about after 25 years, can we not get sued later after 25 years?
And it's not
For
right
me,
to assume.
because it is a notifiable disease, I will mention it.
Stop again. See.
Okay, first of all, for you to be sued, it will have to be within 2 years. Second of all, you're assuming that the child has HIV without being tested. You're forcibly testing the child. There's only a 25% chance. There's a 75% chance that the child doesn't have HIV. So without the parents approaching the hospital, you have still tested the child, which is against the principles of you're abusing your power.
Yes, okay.
Right.
They swap.
Okay, I'd like to continue from here and say standard prenatal postnatal guidelines declare that any parent with HIV positive status has to get their children tested, and that is under the norms which are under notifiable diseases category. And also mention that the central surveillance for HIV doesn't ask for a parent's or any person's consent irrespective of their HIV statuses, and it is clearly laid down in the NACO guidelines.
Can you tell what's the problem in not taking the consent, Tanya and everyone?
It's now.
Yeah. Go ahead.
Okay, so I don't know who's speaking. I'm going to speak. So, guys, you have to understand that laws are made to benefit the people. They are not meant to force the people, right? And this is very important. Just because the law says that it is a notifiable disease and it should be notified does not mean that the parents have to do it, and the law cannot force them. That is literally what autonomy and that is literally what consent means. That an individual, just because they are part of a larger society, does not mean that the government can force them to do whatever the government thinks is best for the society. That is
Just let me give you a very logical rebuttal on autonomy. Keep a knife in hand, go out and kill someone and tell the autonomy. I just thought it myself, right? No, the police acting in the larger interest of the society have to prosecute that person. Or even in Samira Kohli judgment, which is a 2003 landmark judgment, the court ruled that even emergency cases you do not need
30
the
seconds should
patient
be asked.
consent.
30 seconds.
This was just a stray
Yes,
away
so first of
from
all,
the mainstream scenario. First of all, I would like to say that the HIV is not curable. It is only treated by antiretroviral drugs with the mother followed. And on what grounds are we saying that are you and the defendant assuming that the child would grow up and affect the community? What if it doesn't decide to have sexual intercourse? What if he doesn't say that I don't want to have sexual intercourse and I won't spread it to anyone? the person can be confined to
Your
it.
time is up. Thank you, both teams. That was very, very heated and very, very interesting. I really liked how it went back and forth, and also how you all listened to what the moderator had to say. Thank you. With that, we'll take some time and calculate the final scores. We will come out with the results soon, but great job. Really good job.
Guys, till the time you guys can have water or maybe.
Or like breathe.
Yeah.
It was
Things
fun.
are-
Actually, I liked a lot.
Sorry?
I can see future Arnab's here.
Yeah, it's very.
Well done,
Actually,
guys.
this is
Amazing.
way better than the first round, and for that I'm eternally grateful to the moderator. And we are sorry to have caused the confusion before.
Because we were
Yeah,
not
I
part
think
of the complete
raising a
process.
lot of objections didn't help either of the team. Like listening to the arguments more, I think it's better to rebut them later in your speech rather than to like interject. That's
We
what I
are
felt
all
after
on
the first
the
round.
same page here. We have to sensitize and educate the other people. We are not actually doing that on our grounds.
True.
So it was
But,
very well carried out. A big hand to the moderators, and guys, you were also great. Thank you so much.
Thank you.
And I think both Keegan and I learned a lot throughout this process. So thank you to all the teams who participated for so much of your knowledge that we gained through this.
And thank you to our collaborating organizations as well, MSAI, AMSA, IMA. Thank you for sending on teams. It means a lot to us that you all would support us in such a way, even sending it up on your forums and getting your network involved. It really is super nice that you've done that.
Great debate, and you have done very well. Congratulations for the high quality.
Thank you.
Thank you.
Thank you so much, ma'am.
We have Manashri here, so we are just going to ask her to say a few words to everyone that is on. She is the president of the Rotaract Club of the Caduceus, and she was also a participant. So thank you for graciously participating, Manashri, and we would like to hear a few words from you.
Thank you, Keegan, so much. So first of all, I'd like to thank our panel, our judges, and Dr. Russell D'Souza, sir, for giving us this great opportunity and allowing us to carry out these 3-day long events. And also for Shubham, sir, because he's all of us. And it's very proud moment for me that both my directors, Rotaractor Keegan and Rotaractor Anusha, have continuously been in touch with the different time zones and managing everything and carrying out such a wonderful event. And as a part of being on the participant, we like to highlight this point that this was a very, very nice event. And it was a great learning exposure for, I guess, all of us here. So thank you everyone for this wonderful journey and experience.
Thank you, Manashri. Thank you also to the other directors of IS and HRD. I know you all have worked very, very hard and make this event become a reality. It's been, I think Anusha and I would both agree that even though Anusha did a lot more work than I did, we would both agree that this is the most work we have done for an event.
Oh my God.
Yeah, it's the most
Insane.
work that
Last
we've
time,
done.
Like I The think we directors and everyone has been perfect here, and the time arrangements and carrying the execution, it's obviously a team effort, and the entire team of RC Caduceus is really proud of everyone here.
Yeah, like really amazing, guys. The amount of work you have put in this event and all the 3-day workshop. So that was like really amazing. Kudos to you all.
And thank you, Shayan. For everybody who doesn't know, Shayan is our vice president at Rotaract, and he's been so supportive. I called him up at, I think, 7:30 or 8 today morning because I had some issue with technical aspects to this. So I'm sorry for that phone call, and thank you for always being there to help us through the process.
That's my job to be there for you all.
Aw.
So I think after this very cute moment, we should announce the results.
We are
Yes,
still
we are
waiting for
waiting for the
judges.
results actually.
Yeah, they're finalizing.
We're
Yeah,
as
finalizing.
excited as everyone else. Also, since we have people on the call still, there's an international certification course that we are doing with Dr. Russell D'Souza sir and a lot of international faculty throughout the world. So if you are interested in getting an international certification from the UNESCO Chair of Bioethics in the field of bioethics, it is a 14-week course, 1 hour each week, and it won't be too hectic, but it'll be very, very comprehensive. I promise you all. Please get in touch with either Anusha or me or Shubham, or actually anyone from the Caduceus team. They will
Yeah, we'll drop the
direct you
links in.
to. Yeah. Meanwhile, do you want to drop the link for the certification, Anusha?
Yeah, that's what I'm doing. Yeah.
Anusha, we can also drop the link for post-event form so that everyone fills it.
Yeah, that's what. And the group is exploding. If I don't tell you this, become a member of the Rotaract Club of the Caduceus. Anusha will send the link for that as well in the chat box. So if you like what we do, and check out what we do on our Instagram page and our Facebook page. But yeah, if you like what we do, definitely become a member. Do join our movement. It is a wonderful learning experience for each and every member that is part of the Caduceus family. So the first link, just to remove ambiguity, the first certification course, the certificate link will be shared in a short while.
I know it's getting a bit late, but since the competition was so tough that they need more time to come to a particular result, so we are just waiting for them to finalize the result.
Can I request Dr. Sonali also to come on video so that we are both present?
Yeah, ma'am, I'm there, and we are having the results with us, and it was really a
Okay,
tough
ma'am.
task for us. Is that?
Yeah,
Ma'am,
I
can
think
you all switch
excellent.
on your video, ma'am? That would be
Yeah,
really nice.
surely.
On. Okay. Yes. All right. So we are here. First of all, a really good congratulations to both teams. I think, like some already mentioned, I think that your final case presentation, discussion, and interaction was more organized, and therefore we got much more content out of it. The first ones also gave us a lot of content, but this perhaps utilized the time more effectively. So that was very nice. And like we already said, both of us were completely impressed by your knowledge.
Yes.
I don't think I can pick back with all these IPC sections and CRPC this. I really don't think I know all the numbers at the speed with which you all come out with it. So well done, fantastic. Second, like like it was mentioned by Dr. Mrinal and Dr. Princey, somebody has to begin and somebody has to come first. But overall, the standard that you all have set is so good that you all need to give yourselves a good pat on your back and say, good job, well done. Yeah. And this is what Dr. Sonali and both think. So we are really proud of the fact that we were able to judge something of this standard. Well done, children. Okay, now for the results. I will start with the runner-up for the best speaker. And that goes to Katyayani from the Antivaxer team. Is Katyayani there? I'm sorry if I'm mispronouncing your name, Katyayani. Is she there? Okay. The best speaker
That goes to Tanya from Justice League. Well done, Tanya. Congratulations. Your delivery style is very deliberate. Both of you, Katya and you, are very confident in the way you all speak. And you tend to think, it appears that you pause and speak, which is very important in debates because it helps to bring across the fact that there is thought behind the speech. So, well done. The best presentation, and that goes Team Ninja. We like the way you presented the case and followed it up with the PPT with information. I like the pairing of your information that you all gave through. Even your slides were very attractive. So congratulations. And now we come to the winning team. And the winning team or the best team, congratulations to Akash, Prachi, Dipanshu, Pratishta and Neil. No, Hera Fery, well done.
Thank you,
yes,
ma'am.
Excellent. Justice League was also very good.
Thank you, ma'am. Thank you so much, ma'am.
There was more
Thank you, ma'am.
in the arguments presented by No Hera. Your content was very good. Dr. Sonali, if you'd like to say something.
Yeah, I liked even the part which they had at the time that the chat they had when we were working on the result. They were they were having a free discussion. That's how this whole activity has helped them. And I hope that every one of you has enjoyed and learned out of this. And it's a really a good platform for all of us to celebrate the World Bioethics Day in a true and a very relevant manner. So congratulations to all of you and keep the same spirit.
Thank you
Are we
so
allowed
much,
to
miss.
reveal the name of our organization now?
Yes.
One last word is a big thank you to the organizers, the moderators.
Yeah, they did a great job.
Very well coordinated and very maturely handled.
Yeah.
Excellent job. Congratulations.
Shubham, Kegan, Anusha, everybody has done a great job.
Thank you so much, ma'am. Thank you so much.
Keep
And
it
now
up.
we have the name of the organization. Someone is dying to tell the name of the organization.
Medical Student
This is
Association.
MSAI.
Yeah.
So
Okay.
let's start from No Hera Fery. Which college is that?
MSAI.
Medical Student Association.
Ah, okay.
Okay.
Medical Students Association of India. Team No Hera Fery is actually MSAI.
Okay.
What about the Justice League team?
Alfred, you're muted.
Justice League is Asian Medical Student Association, AMSA.
Okay, AMSA India.
Well done. Ninja?
Ma'am, the team Ninja was from Rotaract Club of the Caduceus.
Okay.
You're from Rotaract. And what about Antivaxers?
Antivaxers.
Where are you all from? I can't see anyone
They're from IMA. They're from IMA MSN.
Okay.
They're on this call, but yeah, Indian Medical Association.
Okay.
Well
Fine.
done. Very well done.
Thank you, ma'am.
We should be proud of our students.
Yeah. We have Princy ma'am. Princy ma'am, yeah. We would like to hear from you at the concluding date.
Yeah. Thank you so much, dear students and dear judges, taken all this time right through the whole of the Sunday beautiful morning has been spent for bioethics, and I'm sure this investment will not be giving you dividends. It will surely fetch you a lot of dividends, if not monetarily, at least you will have a comfortable and conscientious sleep right through our lives. So friends, it was really amazing the way it was conducted and how it was dealt with. The case scenarios, we are all seeing it, but it was really handled well by the various IMA, MSN, the IMSA and the Rotaract group. They've done a good job. And organizing, kudos to you all. And your teamwork, that is what is success. Together we can, right? Together we can.
Yes,
so that's the success of all. All the best next time, next year. Let's hope for some more programs.
Thank you so much, ma'am. Do we have Shilpa Sharma, ma'am?
Thank you, ma'am.
Thank you, ma'am.
What happened, Shubham?
Ma'am, heartfelt thank to you, ma'am. I know like Dr. Sunani, Dr. Shimpa Sharma both are busy. Actually, Shimpa Sharma ma'am is busy with the workshop, but then also she, made a time out of her busy schedule to spare her time with us. So, ma'am, definitely thank you so much for that, ma'am. And even Sonali, ma'am, due to the busy schedule, ma'am was a bit busy with her schedule, but I thank you a lot for making this event a grand success, ma'am.
Shubham.
Well worth the time we put in, I think. We learned a lot. Thank you to
Yeah,
all the
yeah.
Thank you so much, ma'am. Thank you so much.
Thank you to all participants. Have a nice Sunday.
Thank you,
Thank
ma'am.
you. On that
Bye.
note, we request everyone to put their cameras on, all the 4 teams and our judges, MSAI, AMSA, IMA MSN, and Rotaract have here. So let me know when you all are ready. Yes. Thank you so much for joining us this afternoon and morning.
Thank you so much. Thank you so much, Mary, ma'am. Thank you so much, Princey, ma'am.
Also, a special thanks to everyone who were part of the organizations that helped us. Kul, Shman, Priyansh,
Molly.
Molly, Purva, Shraddha. I think I'm naming all. Hopefully, I'm not missing anyone. But if I am, sorry.
We do hope to collaborate with your organizations in the future as well. So looking forward to many more competitions of this kind and other collaborations.
Basically, give good feedback.
And thank you to Keegan, Anusha, Rahul, Dhwani, Shubham, Jalak, Manashwi, and Kathleen.
A
So
special
proud of
thanks to
all.
Anusha and Keegan. Like they have really worked hard
True.
for
And
this
you,
thing to
Shubham.
become a grand success.
And you, Shubham. Let's be modest. Let's not be
Yeah.
modest. Okay, if everyone has filled the certification form, I will end the meeting and not take any more of your Sundays. I'm sure a lot of us have to go and eat lunch as well. And so I will let you all do that.
Oh,
Thank you for
thank
joining
you.
again and thank you for a wonderful event. Have a good day. Bye.
Thank you.